بسم الله الرحمن الرحيم الحمد لله رب العالمين والصلاة والسلام على رسوله الكريم وعلى آله وصحبه أجمعين ومن تبعهم بإحسان إلى يوم الدين أما بعد فإن الله سبحانه وتعالى يقول في كتابه العزيز والفرقان الحميد فأعوذ بالله السميع العليم من الشيطان الرجيم أفمن شرح الله صدره للإسلام فهو على نور من ربه وقال تعالى ألا بذكر الله تطمئن القلوب وقال تعالى وأنه كان من الجن وأنه كان رجال من الإنس يعوذون برجال من الجن فزادوهم رهقا صدق الله العظيم إن الله وملائكته يصلون على النبي يا أيها الذين آمنوا صلوا عليه وسلموا تسليما اللهم صل وسلم وبارك على سيدنا محمد وعلى آله وأصحابه وأزواجه وذرياته وأهل بيته وخلفائه ومن تبعهم بإحسان إلى يوم الدين رضوان الله تعالى عليهم أجمعين. Respected brothers and sisters, today we have very important guest all the way from America, United States of America, who is expert in many fields. By profession is neurologist, is professor of neurology, mashallah, in K Western University in Ohio, and he is with us today. But before we go into that, let me just introduce the topic of today. There is one surah in Quran which is basically named after jinn, Suratul Jinn. And then there is Suratul Inshirah, Alam nashrah laka sadrak wa wada'na anka wizrak alladhi anqadha dhahrak wa rafa'na laka dhikrak fa inna ma'al usri yusra inna ma'al usri yusra. So either we have a problem because of tension or because of, you can say, pressure or whatever, or we have any difficulty and hardship, and wherever there is difficulty and hardship, then you need to look at Surah Al-Inshirah. Sometimes there is problem to do with depression or with magic and so on, this and that. So today we will be discussing about depression, which is basically a symptom, not disease. That's the whole idea. With me, mashallah, is my brother-in-law from United States of America, Dr.Tanvir Syed, mashallah, who is not only professor in medical sciences and so on, but mashallah have extensive knowledge of Islam, memorized Al-Quran by heart in very short period of time, and have understanding of you can say social and economical problems and challenges. So I will welcome him, inshallah. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum assalam wa rahmatullahi wa barakatuh.
How are you feeling, mashallah?
Alhamdulillah rabbil alameen. It's a pleasure to be here, and I greatly appreciate the invitation to speak on your channel.
Thank you very much. Pleasure. So what's the arrangement for today? What you would like to talk about and how it will be done?
I think we'll start with a 45 to 50 minute lecture. I'll inshallah take you through some slides on depression and describe where depression comes from, what the existing medical theories are as to the cause of depression, as to the treatment of depression, and inshallah we will finish with treatment of depression through a natural holistic means, and also discuss the Islamic angle of how to treat depression and how to prevent depression as well, inshallah.
Right, mashallah. I guess in Western countries, majority of the people, their main cause of illness is depression.
Or what I would argue is that depression is actually a symptom, and I believe most of it is self-induced.
Yes.
And that's the argument today. But you're absolutely right that depression is a disease, considered a disease or labeled as a disease.
No, it's a reason of the illness. Is
yes,
a cause, you can say.
Correct,
not
correct.
the illness itself, but
correct.
It is one of the factor behind
that's absolutely
someone's, you can say, feeling tiredness or this and that. So in Western countries and so on, this is the thing. So what I'm saying, one way or another, is affected to each and everyone out there. Every household needs to listen to this topic very, very carefully. Give good hearing, inshallah, because either you have someone in house who is going through this, or you know someone, so definitely you will benefit out of it, and never know who can, inshallah, cure themselves by today's program, inshallah.
Absolutely, absolutely, inshallah.
So the stage is yours, the floor is yours, and the sky is the limit.
Inshallah. So, billahi tawfiq wa taysir.
Right.
The iPad.
We'll be going, inshallah, towards Dr. Tanvir Syed, and the arrangement, as I said, is basically that he will be giving presentation of slides and so on, and once the slides are presented to you, you will, inshallah, see step by step. The topic will develop itself step by step, from start to finish, from looking at the symptoms, looking at the reasons behind it, what the person goes through, what happens to that person, how the surrounding people can, you can say, assist the person going through it, inshallah.
Having some technical issues.
Yeah, you can start your discussion, inshallah.
Sure. Yeah, so the main idea of this presentation, and the slides will come up in a few moments, inshallah. The main idea is that depression is more of a label. It's labeled as a disease, and it's a label that makes you feel vulnerable, you're victimized, it's something that happens against your will. Anytime a disease is given a name, it means that you're afflicted with this disease, and there's nothing you can do about it but go to a healer, go to a doctor, go to a physician. And that's a theory or view, whatever you want to call it, that I want to destroy today. That's the idea, that depression is not a disease. It's not something that overtakes you, except maybe in rare chemical instances. Otherwise, 99.9% of the time, depression is just a symptom. And most of the time, it's self-induced. And that's the bad news. The good news is that if it's self-induced, then the cure lies in you, in no one else. So the goal is to see if we can save a lot of money, a lot of trips to the doctor, a lot of stigmatization, just by understanding that depression indeed is a symptom, not a disease. And there's a lot of factors that play into this. One is, like we mentioned, money. So if we look at industry plays a large role, a definitely very significant role in medicalizing this disease or this symptom into a disease. And as you'll see, there's a lot to gain from a financial standpoint as well. I do have to prefix my presentation with just one small detail, that I'll be presenting statistics based on American healthcare, so our American population. So most of the statistics will be based on America, but I think by extension, it's not too far of a cry to extend it to the English population as well. So let's start. So first, a disclaimer that all the information in this talk was taken from published books or articles. I'll have a reference section at the end, a very brief one. I have no financial connection with any entity related to sources of this information. And the purpose of this talk is not to give medical advice, so please check with your doctor before making any changes with your medications and other treatments. This is what I'm basically forced to say before any presentation. Hopefully you will take good advice from my presentation, but please don't come back and sue me. I'm just kidding. Okay, so the outline definition, we'll talk about antidepressant drugs, catecholamine hypothesis, it's actually a hoax, and antidepressant drug research, placebo-nocebo effect, cause, cure, and treatment of depression. So Michael Pollan, he's actually a food expert. He says a very intelligent statement that in a capitalist system, you create a problem and then you make money off the solution. Now, I come from America. I live in America. I was born and raised in a capitalistic system. But I do understand that although the UK has a different system, and much of the world does, that slowly the world is converting to a capitalist system. So hopefully this will apply here as well. Sir William Osler, every physician knows who this is. He is a very famous and iconic physician historically. He says all along the history of medicine, the really great physicians were peculiarly free from the bondage of drugs. So being away from drugs and not jumping the gun to prescribe drugs for every single symptom, that's the how you say, a milestone or the mark of a real good physician. So how is depression diagnosed? In the next slide, if you take a look at these symptoms, there's a list of symptoms here. It's interesting. If you have one or two of these symptoms, sometimes even one of these symptoms, then a physician is ready to diagnose you with depression. So look at these symptoms here and see how many you fulfill. Let's see, every day or even one day. If you go to a physician one day and you're asked, are you not full of energy? Do you prefer to stay at home rather than doing new things? Are you often bored? Have you dropped many activities and interests? Have you felt helpless? Have you felt pretty worthless? Are you not happy most of the time? Feel that life is empty? And you can go down the list up to not in good spirits most of the time. The point I'm making here is that, the point we're making is that according to this, everyone has depression, right? If you have any of these symptoms, you can easily be labeled with depression. But if that's the case, and this is exactly what physicians use to make the diagnosis of depression, and if this is the case, then that means all of us have depression, right? At one point in our life or another. Imagine if you lose a job. Imagine if you're going through a tough marriage. Imagine you're recently divorced. And imagine if you're having financial difficulty, health problems in the family. Well, then you're going to fulfill any of these criteria and you'll be diagnosed with depression. And what's scary about that is that once you're diagnosed, you're labeled with this disease as if the disease has nothing to do with you. Meaning it's nothing that you've caused yourself. It's nothing to do with these circumstances in your life, but rather it's a disease that you're afflicted with through genetics, chemicals, whatever it is. And then even more frightening is that we're very, very rapidly, very quickly, once we're diagnosed, we're prescribed medications. So we're talking seconds. The second you're diagnosed, already the doctor is writing a prescription for you, saying you need to be on Prozac, you need to be on fluoxetine, sertraline, Cymbalta, Abilify, Geodon, whatever it may be. So I'm going to give a typical scenario on the next slide for what I've seen in my clinic, and this is very common. This is not something specifically chosen for this talk. This is very, very random, and it's very, very common. A 35-year-old accountant visits her primary physician, her family physician, her family doctor, with complaints of difficulty sleeping, fatigue, daily headaches, some neck pains, and what we refer to as brain fog, or what patients refer to as brain fog, which means you're not able to think as clearly. It takes you a little longer to come to the same conclusions or same logic than on other days. And this is affecting her job and her family life. Just looking at this, I'd like you to think about your own life. I mean, how many of you either feel this way or you know someone who feels this way? Well, anyways, she is diagnosed with depression and prescribed Prozac. Prozac, that's fluoxetine, 20 milligrams daily. And after a few days, her symptoms improve. So a month later, the symptoms worsen again. So she comes back to her physician, and naturally the physician who prescribed the Prozac is going to say, well, if it was working for a month and suddenly your symptoms worsen, let's just increase the dose. So the lady is now up to 40 milligrams daily, and a few days later her symptoms improve. So when her symptoms improve, the natural assumption is that the medication worked, the diagnosis is correct, and the doctor was right to prescribe the medications. Now this cycle repeats a month later until she receives 60 milligrams of Prozac, which is the maximum dosage. Now lo and behold, a month later her symptoms relapse and come back again, and they're worse than ever. Okay, the lo and behold is sarcasm there. She is referred to specialists to look for underlying physical diagnoses, right? And so the psychiatrist or family physician, whoever's treating the patient, says, well, if this medication is no longer working at maximum dose, we have to find other causes for your symptoms. So for the sleep problems, she's referred to a sleep specialist who performs a sleep study, which is quite expensive. The sleep study is negative for a sleep disorder, meaning the sleep study rules out a sleep disorder, and therefore she's prescribed Ambien, which is Zolpidem. It's another medication which is used to treat insomnia, or it makes you sleep at night basically, so it's used for primary insomnia. Primary insomnia is another diagnosis the patient receives, and this diagnosis basically means that you have insomnia, you're not able to sleep properly, and we don't know the cause, so we're going to call it primary insomnia, suggesting that it's genetic again, that it's not the patient's, nothing the patient's doing, has nothing to do with the patient's lifestyle, nothing to do with the patient's current circumstances in life pertaining to herself, her family, her job, etc. And she receives this medication. The patient is also referred to a neurologist, and the neurologist orders a brain MRI looking for a physical cause within the brain or skull that could cause her headaches. It's negative, so she's diagnosed with tension type headache or tension headache, and is prescribed Elavil, which is also an antidepressant called amitriptyline. Amitriptyline is the medication, but it has analgesic properties and helps in tension type headache, and so she is prescribed Elavil as well. And she's also labeled with another diagnosis, tension headache. A rheumatologist then sees the patient, orders 30 blood tests. If you know a rheumatologist or you are a rheumatologist, you'll know how many blood tests there are for antibodies and autoimmune and inflammatory conditions. And the patient is ordered 30 blood tests, and all of these come back negative. And then the patient is prescribed Flexeril for neck muscle relief because there's tension in the neck muscles. So a snapshot summary of the 35-year-old accountant, okay, with multiple vague symptoms over 4 to 6 months. She has 4 new doctors now, not only the primary physician, now she has 3 other specialists, a rheumatologist, a sleep specialist, a neurologist, 4 new diagnoses. So now she's not just a 35-year-old accountant, she's a 35-year-old accountant with depression, primary insomnia, tension headache, and chronic neck pain, and there are 4 new drugs on board. Okay, we're talking, this is in a matter of 4 to 6 months that she went from taking no medications at all, and now on 4 different medications: Prozac, Ambien, Elavil, and Flexeril. That's fluoxetine, zolpidem, amitriptyline, and cyclobenzaprine. For those not familiar with these trade names, I'm not sure if the trade names are the same in the UK. So those are the generic names. Over the next 3 to 6 months, each symptom worsens, so each specialist increases the dose of their prescribed drug. Naturally, if the headache gets worse, the neurologist is going to increase the dose of the amitriptyline. If the sleep problem becomes worse, then the Ambien will be increased as well, and sometimes new medications are added on as well, and so forth. Symptoms no longer improve, and she is maxed out on her medications. She complains to her primary physician that her fatigue is worse than ever and that she walks around like a zombie. Now, why is that? Why do you think she'd be walking around like a zombie? Well, as you've probably guessed, obviously because she's on so many chemicals, so many medications, and she has acquired these medications in a matter of a few months. So, the next slide, primary physician attempts to wean or reduce the dosage of Prozac. And what happens? All of a sudden the symptoms suddenly worsen. And we'll talk about this withdrawal effect in the talk later. So her primary physician and all the specialists become frustrated with the patient. They pass her off as psychiatric, that all her symptoms are in her head. They're all in her head. And these kinds of patients who are labeled as symptoms being all in their head, most physicians don't want to deal with them. They become difficult patients, so to speak. And they're understandably difficult because they're upset that they've been going doctor to doctor, different offices, different specialists, taking different medical medicines and chemicals, putting into their body, and there's no results, rather problems are becoming worse. So the psychiatrist then starts swapping medications and adds on more psychiatric medications and adds on to her diagnoses major depressive disorder, bipolar disorder, suicidal ideation, and generalized anxiety disorder, and a few more. If you think about this, major depressive disorder, bipolar disorder, suicidal ideation, these are not disorders, these are normal reactions, right? If you're going through 5, 6 new types of symptoms that you've never had in your life, and out of nowhere these symptoms are appearing, and you're going doctor to doctor to doctor, taking loads of medication at maximum dosage and there's no results, the natural reaction is to become anxious or upset or angry and even want to end your life. Some folks will just have a migraine for the first time in their life and say, I wish I would just cut my head off. I don't want to deal with this pain. So despite being labeled with all these diagnoses, you have to understand that these are actually normal reactions. These symptoms are normal reactions to the symptoms and what your experience is, what the patient's experience is. So the next slide, between symptoms and side effects, the patient is unable to perform at work. She's fired, she loses her job, she files for disability. It's what we refer to in the States as a disability where the government provides assistance because you're not able to take a job, you're not fit to work from a health standpoint. The disability is denied because according to the officials at the government offices, they say, well, she does not look disabled. She doesn't look disabled. So she has no income now, and she's stuck with all these symptoms. She has no job. She loses her marriage, her home, custody of her children, and we'll stop here. So this is actually a very typical scenario. This is not something very atypical. It's something that happens very commonly, and I didn't have to search far to find this example. Probably every week or maybe even more than once a week, I see patients who have a similar scenario where symptoms start to occur. Patients are labeled with depression and put on medications, and this follows or leads into worsening of the symptoms, more medications, more specialists, etc., until finally they're on disability. They have to file for disability. The next slide shows some statistics in America, which I do not believe are far different from that in the UK and the rest of the world, that 9.4%, so at least 1/10 of US adults experience frequent depression. If we combine the periods 1993 to 2001 and 2003 to 2006, 14.8 million people across, or I should say adults, American adults over 18, in a given year are diagnosed with major depressive disorder. Okay, this is the final diagnosis, not the symptom of depression, the actual diagnosis, meaning it's really affecting the rest of their life. And lifetime major depression has been reported in women 2 to 1 more than men. That's something very important we'll talk about later as well. So the next slide is a little poster. A poster I found, it's very common actually. If you just Google treatment of depression, you'll see this poster or ad come up. What do? See a doctor, get therapy, and step 3 is get medication, what we just talked about. And like I showed you, it's usually very futile what happens. So clarification, depression is a symptom, not a disease. And that's the main thesis of this talk. If you take home any message, this is the main message to take home. And I like this quote here by Kelly Brogan: "The medicalization of distress obliterates meaning and creates profit." Right? It obliterates meaning and creates profit. Creates profit for who? Not for you. It creates profit to the drug companies and other gimmick-generating entities. So let's talk about the depressing truths about antidepressants. Number one, most antidepressants are prescribed by family physicians, okay, not psychiatrists. And as many as 1 in 7 Americans take antidepressant medications. I'm sure it's similar in the UK. And antidepressant prescriptions have increased by 400% between 1998 and 2008. And that's a big problem. Okay? In 10 years, we have a 4-fold increase in the prescription of antidepressants in a very developed, probably one of the most developed countries in the world. And that's a problem because it doesn't make sense. I mean, if we really need that many people, that many citizens, US citizens to be taking antidepressants, or anyone to be taking antidepressants, then how do we survive over centuries, over millennia, right? The human race is how old? You know, at least 5,000, 10,000, they say about, Islamic scholars say about 50,000 years. There were no antidepressants in those days, not these meds. These meds are new. These meds were developed since the 1950s and 1960s. Okay, so if these were so necessary, then how did the human race survive? Why did half the human race not commit suicide 100 years ago or 200 years ago or 1,000 years ago? So there's something going on, there's a problem here. So our next slide looks at the top antidepressant drugs in the United States. Oh, there's something missing here, but well, if you add this up, the top antidepressants comes out to about $9 billion. Okay, these numbers here are in $1,000 million. So 9 billion. Okay, the top one, Cymbalta, it's one of the newest drugs. The reason you see Cymbalta the highest from 2011 to 2012 is because it's a newer drug compared to the other drugs. And if you look at Lexapro, it's relatively new. But if you go down the list here, these are older drugs. So in their years, they made a lot of money for these companies as well. But we're talking billions of dollars, sometimes greater than the GDP or GNP of countries altogether. These are just individual drugs. Here's a commercial. Dishes piling up in the sink, Zoloft. I mean, just look at that. The image of someone who's so down and depressed. Dishes piling up in the sink, that's the cause here. So the cure here is to forget washing the dishes or controlling what you eat. Let's go straight to the chemical Zoloft. It's another commercial. They show a typical scenario. I mean, I think this is a scenario we've all seen in anyone. So anyone who's lived a life has seen this in their home, where there's a fight going on between, I'm guessing that that's a fight between the patient who's in the front, and in the back that's the patient remembering the fight that just happened with her mother. And you look at this, you see this sad doll on the window, and you look at this medication, Prestique, and that is supposed to magically make you happy, and you see the trees and the sunshine in the background. I wonder if this is the same, I think it's the same actor for two different drugs. Yeah, here's another, I'm sorry, this one. This is for Abilify, it's a new drug. I think it's the same actor for the 2 different drugs here, making some good money there. Anyway, so what are they prescribing? You look at this here: Zoloft, Prozac, Effexor, Celexa, Paxil, and others. Out of 213 million were dispensed in 2003 alone. Here's a little figure, kind of a comical thing. You're on the highway, so currently on Zoloft, Prozac, Paxil, Buspar, and so forth. So how do these things work? Well, antidepressants, if you look at the slide here, they're supposed to increase two chemicals in your brain. One is serotonin and one is norepinephrine. And the vast majority, or great majority, of antidepressants work through these chemicals. In other words, if we increase these chemicals, somehow that's supposed to cure our depression. Or the other way to say it is the reason we're depressed is we have too little of these chemicals in our brain. So on what basis was serotonin and norepinephrine linked to depression? And this is kind of scary because this is the basis upon which the great majority of antidepressant medications are validated and verified. And so what's the actual evidence to this? And we'll go back here. This is called the great monoamine hypothesis. Okay? The great is supposed to be sarcastic. Based on two observations around 1955. And so in 1955, in clinical trials which had nothing to do with depression, one had to do with tuberculosis and the other had to do with seizures and hypertension. So in tuberculosis, patients were receiving a medication in 1955 called isoniazid, and it was found that they were experiencing depression. And another group, in another study, seizure and hypertensive patients were taking reserpine, which is a medication precisely for hypertension, but also thought to be a seizure medication, and it was noticed that they experienced depression. So someone put 2 and 2 together and didn't get 4, they got 55 instead. What they said was, and there's a typo here, it should be isoniazid is the first drug. Isoniazid and reserpine, what they have in common is they both deplete a chemical in the body called serotonin and another one called norepinephrine in the body. So it was thought that because these medications, what they have in common is to deplete the serotonin in the body and norepinephrine in the body, that the cause of depression, and these patients experience depression, it must be related to serotonin, too low serotonin. Well, what was very sad, was in 1955, the Lancet, it's a very reputable journal, showed a study of 54 patients who received reserpine actually cured depression. So these patients had depression. They were given reserpine based on the data shown over here, and it actually cured the disease. So that's a big problem. That's a very, very big problem. You have contradicting or conflicting information. And the natural conclusion to draw when you have conflicting information is that your predictor has nothing to do with the disease. It means if in one study you drop the chemical and something happens, and then in the next study you increase the chemical and the same thing happens, then that's a big problem. It means the chemical has nothing to do with the disease. And it doesn't take a scientist or a neurologist or a psychiatrist to tell you that. So going back to the slides here, how did the monoamine hoax survive? Well, it happened actually at Harvard University, one of the eminent universities in the United States, where a Harvard psychiatrist, he found that norepinephrine function was different in the brains of depressed patients. And at that time, you have to understand that psychiatry was a struggling field. In other words, psychiatry was not seen as a medical field. It was seen as a more a psychosocial field, all in your head kind of field. It was not about a medicine, right? And so it was struggling, and this professor here, the psychiatrist, found a way to sneak in psychiatry as an actual bona fide medical disease because it was now linked to a chemical. In other words, once you have a disease that's linked to a chemical in the body, you can say it's a medical disease, right? You can find drug targets for it and treat it with a medication, and you have dosages, etc., and you can formulate treatment plans and so forth. And then most important is the pharmaceutical industry. The pharmaceutical industry was very excited about this. So when they found that a Harvard psychiatrist, an eminent psychiatrist at an eminent university, medical university, was promoting a chemical as the cause of a disease, then the pharmaceutical industry exploded. So well, here's our opportunity. Here's a territory that's the wild, wild west. It's a territory which is uncharted, a territory in which we can now develop drugs and make millions, billions, and trillions of dollars, as you'll see. So going back to the slides, Dr. Joseph Schildkraut wrote a manifesto, the catecholamine hypothesis of affective disorders. Even though there was no evidence, even though the evidence with the reserpine and isoniazid had already proved this wrong, not even proved it wrong, but it didn't even let it get out of the gate. In other words, this never should have been a hypothesis. Well, he wrote this manifesto, and interestingly, or not interestingly, but expectedly, no human study to date, and I'm talking to date, no human study to date has successfully shown a link between low serotonin and depression. This includes studies of blood and urine tests, brain imaging, and even post-mortem studies on people who committed suicide, meaning after these patients committed suicide because of depression. What better proof do you want that depression existed in patients? To an extreme level, they committed suicide, and even these post-mortem studies did not show any difference in norepinephrine or serotonin in these patients. And so a nice statement by Dr. Joanna Moncrief, we have been led to believe that these medications are actually fixing, curing, correcting a real disease in human physiology. We're led to believe this. This is not a real disease. So let's take a closer look at the research of antidepressants. So in 1964, the NIMH, this is the National Institute of Mental Health. This is a major governing body over science and research in the field of mental health, especially depression in the United States. It's part of the NIH, or National Institute of Health. In 1964, look at this statement by Jonathan Cole, who led this task force, or led this group. Depression is, on the whole, one of the psychiatric conditions with the best prognosis for eventual recovery with or without treatment. So it was made very clear in 1964 that treatment was not needed. It was absolutely not needed, and prognosis with eventual recovery would happen spontaneously. Okay, and that argues against the whole chemical theory that that this is a genetic problem and this is a chemical problem in the brain, but rather it's something to do with your circumstances around you. In 1974, so fast forward 10 years, this is Dean Schuyler, he's the head of the NIMH section of depression. He says depressive episodes will run their course and terminate with virtually complete recovery without specific intervention, meaning without a medication, without psychotherapy, with nothing, with no intervention at all. These depressive episodes will run their course and terminate. So what are we doing giving medications, and what's happening when we're giving medications to these patients? And these patients who get medications, they usually never resolve. The depression is usually lasts forever, which we'll talk about later. We'll see later on some slides. But the point is that if these things are going to resolve on their own, then why are we taking medications? Why are physicians prescribing these medications and filling our brain with chemicals? And patients never get off these chemicals, as you'll see, which means we're responsible, as physicians. If we're prescribing a chemical to a patient and that chemical is not needed, and then the patient must stay on that chemical lifelong, that's a great zulm, or injustice, we say, right, to patients. It's not real medicine, right? So going back, another study in 1963, recurrent vital depressions, a follow-up study of 56 female and 28 male patients, reported that antidepressants increase long-term recurrence rate and shorten duration of depression. So they might actually shorten the duration of the depression itself, but they'll increase the recurrence rate, meaning the recurrence is going to come back with these medications. In other words, if you don't give any medication at all, the depression comes and goes and leaves. If you give medications, these antidepressant medications, the depression goes away quickly. So it shortens the duration, but then it recurs over and over again, increases the recurrence rate. That's what's scary about the medications. A next study, it showed that 50% of drug-withdrawn patients relapse within 6 months. So once the medications are withdrawn, the depression comes right back. Okay? Next study, 71% of depressed patients relapse within 18 months of drug withdrawal. That's a great majority, 71%, they relapse. So in other words, the medication is doing something. This disease is supposed to come and go, or this symptom is supposed to come and go. But when you give a medication, now a relapse occurs. And those relapses don't occur when you don't give the medication. So in the absence of medication, the disease goes away forever. With medication, it might go away initially, but then it comes back again. Another study showed that 69% of patients withdrawn from an antidepressant relapsed within 6 months, and there was rapid clinical deterioration in most of the patients. So when the disease does come back, there's a rapid clinical deterioration. Again, that's a very scary thought. In 1992, so now we're coming up much closer to more modern times, in an 18-month study by the NIMH, they found that they compared 4 types of treatment, 2 forms of psychotherapy, an antidepressant and placebo. The group that was initially treated with the antidepressant had the lowest stay-well rate by the end of the study, meaning they suffered the most. These medications will make you suffer, and that's the bottom line. That's the take-home message here. So antidepressants worsen depression in the long run. The antidepressants cause unnatural chemical fluctuations in the brain that destroy and prevent development of your natural survival skills. Right? So if you're sad in response to something and you take, meaning response to a life occurrence or lifetime occurrence, some kind of occurrence in your life, whether it's a divorce, marital trouble, trouble with children, trouble with your finances, economy, your job, your social life, whatever it be, then you take a medication, you're fluctuating or you're artificially changing or fluctuating the chemicals that are naturally in your brain. And if your symptoms get better, you'll never understand how to deal with those problems, right? If instead of developing your skills to deal with life problems and developing yourself as an adult, as a good Muslim, instead you're taking a chemical that's going to take away your innate ability to deal with lifetime problems, lifestyle problems, or common problems in life. And so antidepressants are very, very highly, in the next part of the slide, are highly addictive and lead to long-term disability. This is very, very important. They're highly addictive. We don't think of antidepressants as an addictive medication. We think of pain pills. We think of narcotics and morphine, for example, and Percocet and Vicodin. These medications, these pain pills, we think of as addictive, or even addictive drugs like cocaine, for example, and opium and heroin, etc. But these are actually very, very addictive medications, and they lead to long-term disability, meaning it's actually proven, it was proven scientific in a very nice study that antidepressant drugs, once you're on them, you have a very high risk of developing disability, meaning long-term disability, meaning you won't be able to work later in life. Very soon, within a few years, you end up on government assistance and you lose your career, lose your job, and so forth. So what explains antidepressant effects in clinical trials? That's the next section here. And so clinical trials are published, which show that while we gave Prozac to a group of patients, we gave, which is an antidepressant, we gave a sugar pill to a group of patients, and the Prozac group, the antidepressant group, did better. If they did better, then it means the medication works, right? Well, that's what I want to go through now, is what explains these effects in clinical trials? Why were these clinical trials actually successful? And just to summarize, the FDA, the Food and Drug Administration, they're the governing body in the United States that basically approves medications for use. So a drug has to be FDA approved before it can be prescribed for a certain disease. And the FDA requires 2 short-term trials, meaning a 3-month or a 6-month trial, that shows that, with a few characteristics. The trial has to be prospective. So we can't just take 50 people who took a drug and say, well, these 50 people took the drug, they feel better, that's it, let's prescribe. Rather, you have to do it prospectively, meaning you have to identify patients who have the disease, in this case depression. Then you have to give them the medication, and you have to look forward and see in time and see how do they prosper, how do they do, and you have to measure that outcome. The second element, it has to be double blind. Double blind means that neither the prescribing physician knows, the prescribing physician does not know whether the patient is receiving the actual drug or the fake sugar pill. And likewise, double blind, that's a single blind study. A double blind means that the patient themselves also does not know whether they're receiving the drug or the placebo. It's called a double blind study. Otherwise, if the treating physician knows what the patient is taking and the patient knows what they're taking, or either or, then it will skew the results of the study, right? They'll know ahead of time what to expect, and you can kind of, these physicians can kind of fudge the results, so to speak, right? So to avoid that, we call it a double blind study. There's also randomization, meaning we can't choose who gets the drug and who gets the placebo. The study has to be randomized. It's usually 50-50, but it's usually through a random generator where a pill comes to the patient, and not till the end of the study is it even found out what the patient received. And then it has to be placebo controlled, which means that there's a group who, like we said, receives the medication or drug, and the other group will then receive the placebo or usually a sugar pill or a pill that has nothing in it. Sometimes it could be a crystallized substance which has no effect. It just goes right through the GI. Now, if both of these trials show that the drug is superior to placebo, then the FDA will approve the drug, and the drug can be prescribed by physicians. And that's the idea. So what is placebo? So you see here, test drug and placebo. They look exactly the same usually. That's how it's supposed to be. In fact, they have to look the same so that it's truly double blind. And you have a study population, see on the left, and then they're randomized. The top half here will receive a sugar pill. The bottom half receives the drug. And what you have then is an effect. And so this bar graph shows you an effect. On the left, it says changes in placebo group. So the higher that bar, the better the effect. And the changes in the verum group, verum in Latin means true group, means the group that received the drug will then have its effect. And what you hope to find is a higher bar. And what you see here, the light gray at the top, that's the actual drug-specific effect. So in other words, that larger bar, a good chunk of it can be explained by placebo, not by the drug itself, whereas that tiny part at the top of the bar, that lighter gray, that's what tells you the drug's effect. And hopefully that the drug is large, or the drug companies hope that the drug effect is larger than the placebo effect, of course. So what is the placebo effect in trials of antidepressants? Well, there were two landmark analyses of placebo versus antidepressant. So in 1998, they looked at 3,000 patients and found that 75% of the drug effect is actually placebo. That is very scary. That means 75% of the drug effect is placebo. That means that if you didn't do anything, if you didn't give the patient any drug, then they still would have had the same effect, which is scary. It means, well, why are we giving them the drug then if 75% of the patients improved to a sugar pill, which costs 5 cents and doesn't mess with the chemicals in your brain? Why are we giving these patients these medications which cost thousands of dollars per year per patient, sometimes out of pocket? We're giving patients these chemicals, they mess with your brain, they take away your natural survival skills, and we're giving these medications. Why are we doing this if 75% of the effect is just placebo, right? And what's even scarier, if you go back to the slide, is that the remaining 25%, we said, 75 plus 25 is 100. So the 75% is a placebo, the other 25% is an active placebo effect. I mean, it's not actual drug effect, it's active placebo effect. And that's scary. So what is that active placebo effect? So let's look at an example here. Here's a trial which looked at a drug on the left. You have psychotherapy, no medication, but psychotherapy to treat depression, placebo to treat depression, and no treatment. Now you look across these bars, what you see here is the placebo is very high. In other words, there's almost 120% improvement in symptoms just through the placebo. Now, if I were to ask you, would you rather receive a $1,000 drug every day, or it's going to cost you thousands of dollars per month, or thousands of pounds per month? It's going to cost the healthcare system, the government, everyone this amount of money, when you can have a natural 120% improvement in your symptoms, but just by taking a fake sugar pill. I'd rather you give me a fake sugar pill and cure me, or blow on me, or say something to me and cure me, rather than give me a medication which is going to mess with the chemicals in my brain. Now look at the drug effect. You see the drug effect, back to the slide here. The drug effect is a little higher, not so much higher, it's a little higher. And what's scary is that 75%, as you see, of the drug effect is truly just placebo. If you draw a bar across, you can see that. Now going to the next slide, when patients in a study, what is active placebo? So I want to go back. If you see this added 25% up here on the left with the red star, that's an active placebo. What is that, active placebo? Meaning, why is that happening there? Well, what it is it's interesting. If you look at side effects from a drug, imagine you're in a drug trial. Imagine you're taking either placebo or you're taking an actual drug, a chemical. Is there any way to unblind it? Meaning, it's blinded to you. You as a patient, if you're taking a medication, you don't know if it's good. If you're in a study, you don't know if it's a drug or a sugar pill. But do you think there's a way that a patient could figure out that they're actually not taking, that they're actually taking the drug, not a placebo? And there is, and the reason is because antidepressants have major side effects. In fact, Prozac or fluoxetine has the highest reported number of side effects. 40,000 side effects in the trial alone were reported. So what happens here is when the patient takes the medication, the patient feels a side effect. It could be dizziness, or it could be joint pains, it could be stomachache. And so they figure out they're not taking the sugar pill because the sugar pill is not going to cause side effects. And they figure out they're actually taking the medication. And if you account for that, if you account for the number of side effects reported in these trials, you'll see that it accounts for that other 25%, of effect. In other words, nearly 100%, almost 100% of the effects you see in drugs are purely due to placebo. It's not an actual effect of the drug on the brain, which is very scary. And so in other words, going back to the slide, therefore antidepressant clinical trials are not blinded. The last statement, they're not blinded because patients can figure out they're receiving the drug. And this is a big problem, right? So Eric Turner, very interesting study he did in 2008, he used unpublished data, and this is very scary. So something you may not understand, but you may not be aware of, is that when a drug company sponsors a clinical trial, and nearly all clinical trials are sponsored by drug companies because they are so expensive to run that institutions and universities don't have the funding to run these. And so usually drug companies, they sponsor the study. It's millions of dollars. It pays a lot of salary, pays a lot of money to universities and so forth. So there's a lot of, it's a very lucrative business, let's say. It shouldn't be, but it is. And that's just reality of how it works. And what's really scary is that when these drug companies sponsor the trials the drug companies get to decide whether you publish that data or not. So if the results are not in favor of the drug company can tell you not to publish that trial. So going back to the slides, in 2008, very interestingly, Eric Turner found that there were 74 studies on 12 antidepressants. And of these studies, 38 studies were positive, meaning these 38 of these 74 studies argued in favor of the drug, that the drug was better than placebo. And of these, 37 were published, meaning the drug companies allowed these to be published. Now what's scary is, look at the next line, 36 of these studies were negative, meaning only 36 were negative, 38 were positive, and 36 were negative. So just as many positive studies you had almost just as many negative studies, which means this is all chance. This is not a real effect. This is all just chance. It's like flipping a coin, heads or tails. 50% of the time you'll get heads, 50% you'll get tails. And of these, only 3 were published, okay, as negative studies. 11 were published with a twisted conclusion. The conclusion was twisted in a way to make it look like a positive study, and the remaining 22 studies were never even published. That's very, very scary. So we're being lied to is what it means. It means really we're being lied to. We're not being told what's actually out there, what the data is. We're only being shown data that supports the drug companies. And going back to this, the slides here, in 2008, Kirsch published another meta-analysis. He used something called the Freedom of Information Act, and he accessed unpublished antidepressant drug data, and he found that 26 out of the 46 trials did not beat placebo. And he also found that those that did beat placebo only resulted in a 2-point change, or less than 2-point change on the Hamilton Depression Scale. What does that mean? If you look at the next slide, the depression scale, if you take this scale, you take this questionnaire, it tells you how depressed you are. Are you normal? 0 to 7. Looking at the right here, 8 to 13, mild, 14 to 18, moderate. In other words, the drug only improved over placebo in those other 20-some trials. It only improved by 2 points. Now look at the score here. If you look at the score, that's not much, right? If you're a 14 going to 16, you're still moderately depressed, right? That's not a major change here. And so there's also something else called a nocebo effect, or proof of active placebo effect. Just to show you, this is very scary as well. On the left here, you see a clinical trial. You have patients receive fluoxetine, which is Prozac, for 12 weeks. And then the group is split. Those same exact patients are split into 2. One group receives placebo, and one group receives fluoxetine, but they're not told. So they don't know what they're receiving, whether it's placebo or fluoxetine. And look what happens. It's very scary. In the unblinded portion, so this slides here, what you see, the fluoxetine part here, that's the unblinded part over here. Everyone who took the drug felt some kind of drop in their depression score, which is good. A higher score means more depression. But then what happens at 12 weeks? Remember, at 12 weeks we're switching from placebo. We're switching now. Half the patients are going to receive placebo and half are going to receive fluoxetine. What happens is both the drug and placebo patients become more depressed. What you'd expect is just the placebo folks. So just the placebo folks you'd expect to get worse with depression because they're not receiving the drug anymore. But notice that the drug patients, in other words, these patients continued to receive the exact same drug. Nothing changed. The only thing that changed is they were told that they could be receiving placebo now. And if you go back to the slide, you see the drug group actually increased. The drug group actually became depressed. In other words, the drug no longer had effect just when they were told that they might not be receiving the drug, which proves that these drugs are not having the effect. It's your own mind that's doing it, right? It's your own mind. That's what we call placebo. Once you take this drug, you believe that you're coming out of the depression. That's what happens, which is bad news in that you've lost this money and you put chemicals in your brain. But it's good news because it means that you can cure it. It means the cure is inside you, and you don't need a medication for this. Going back to the slides, we see real, fake, both can cure depression. This is from a commercial. Also, if you believe it will affect you. If you believe it will affect you, then it will. If you don't, it won't. I like this little cartoon. These capsules are fabulous. When I look at the box, I stop coughing. Here's a nice, you see a physician or researcher, he's talking to a board of investors, a board for a company. He's saying, our trials show that the new drug performs no better than placebo. So what do they say? Well, maybe we should invest in placebos, which is very true. You probably make a lot more money because you don't have to buy much with the placebos. You're buying a sugar pill. So The Emperor's New Drugs, a very nice book from Irving Kirsch. I took a lot of information from his book. It's one of the references, Exploding the Antidepressant Myth. All right, so let's talk about cause and cure. So Kelly Brogan says this in her book, A Mind of Your Own, I think it's called. It's referenced at the end. A very, very nice book. A lot of information is taken from her book as well. Lies that we've been sold. Number one, these are all lies. We are broken. Give fear as an appropriate response to symptoms. We need chemicals to feel better. Doctors know what they are doing. The body is a machine requiring calibration via drugs. A little too much of this, a little too little of that. What's the truth? The truth is prevention is possible, number one. Depression can be prevented. Number two, medication treatment comes at a steep cost. Number three, optimal health is not possible through medication. Okay, and it's absolutely not possible, as you'll see, and you've seen the examples already. Your health is under your control, and working with lifestyle medicine, simple everyday habits that don't entail drugs, is a safe and effective way to send the body a signal of safety. So the cure and prevention of depression comes from three elements in your life. Okay, number one is diet, number two is exercise, and number three is relaxation or sleep. Okay? If you focus on your diet, exercise, and sleep, which we usually don't, and you'll see that those who are depressed usually have trouble sleeping, have trouble with exercise and diet, but they see that as a result, not a cause. It's actually the cause. It's actually the cause of the problem, not an effect. Depressive symptoms can make these things worse as well, but the point is that these are the actual cause, and the cure lies in these things. So we have to watch over these elements in our own lives daily. That's what's important. Consistency is important. So what is leaky gut? So leaky gut. So when we eat bad foods, and we'll talk about this, actually we might talk about this at a future date, but there's a lot to talk about. But leaky gut has to do with eating inflammatory foods. When foods that are inflammatory are consumed, the healthy gut lining that inflames and allows nutrients or things that should not go across the gut to go into the gut, go across the gut barrier, enter the bloodstream, and inflame the body. And it causes all kinds of havoc around the body. There's brain problems, skin problems, thyroid, colon, adrenals, joints, sinus, and mouth disease. You see depression, anxiety, ADHD, acne, rosacea, eczema, Hashimoto's thyroiditis, constipation, diarrhea, irritable bowel disease, and you name it. You can have rheumatoid arthritis, fibromyalgia, etc. And of course, there's a blood-brain barrier as well. If you look at a normal blood vessel on the left and a blood-brain vessel, what you'll see is that there's an added layer of protection on the right, which means that when you take a chemical in, these chemicals can go across your bloodstream pretty easily, but not into the brain so easily. What's very scary, though, is that in the case of inflammatory foods or leaky gut syndrome, chemicals actually cross into the bloodstream and actually get into the brain. Very, very dangerous. So here's radiation damages. So radiation will damage the blood-brain barrier. We'll talk about this later as well. That when you consume anything with radiation in it, or you receive any kind of radiation, it damages the blood-brain barrier. And what happens here is that chemicals that are not supposed to go in the brain actually end up in the brain, and that causes a lot of problems, including depressive symptoms. So what is the antidepressant diet? I tried to summarize it. I don't want to make this a very long talk, but this talk can go on for 3-4 hours if we talk about diet alone. But just some basic elements here. Number one, eliminate sugar that is not in its natural form. In other words, if you're eating something that's sweet or has sugar in it, make sure you can see the original form. Okay, if you cannot see the original form of sugar, then don't consume it. And what I mean by that is an orange, for example, that's a natural form of something sweet. Eat the orange, you'll be fine. Now, if you take that same orange and take the sugar out of it, it's about maybe a teaspoon of sugar or half a teaspoon of sugar, and consume that sugar, you're still eating the same amount of sugar, but it's very, very different. And the difference is as follows. It has to do with surface area of the gut lining. What that means is when you eat a date, for example, or you eat a fig, or you consume an orange, and you bite it, the orange bite, so to speak, will enter your stomach, into the stomach lining, as clumps of undigestible fiber. So the sugar is actually buried in clumps of undigestible fiber. Okay, and what that plays a very important role. That means that clump is going to sit in your stomach, and the sugar is going to be released slowly. It's like time released. Okay, it's not sugar that's released suddenly. It's time released. So your sugar in your blood never really rises so quickly after that orange or date or fig, whatever you eat. It rises very slowly, And in accordance with that, insulin from the pancreas also rises concomitantly and concurrently very slowly. Insulin causes a lot of damage. In fact, we say that those who have a sweet tooth those who eat a lot of sugar, a lot of starches, that you swim in insulin. There's insulin swimming in your body all day. You have so much insulin, that causes all these problems, causes depressive symptoms, etc. So that's what happens when you eat a natural fruit. Now, if you take that same sugar from the orange and you consume just the sugar, the 15 grams of sugar, for example, that sugar enters your stomach, coats your stomach lining, and enters your blood at a rate so high that to match that rise of sugar and rise of insulin, with oranges, you'd have to eat a whole football field of oranges. Or literally, you'd have to actually line up a bunch of oranges on a football field, consume them all in the same amount of time to get that kind of sugar rise. So when you consume that sugar, that table sugar, even though it's the same amount of sugar in an orange, your pancreas is looking at you and screaming profanity, saying, "What are you doing to me? What are you sending me? I've never seen this before." It's literally like taking your pancreas and squeezing it, and squeezing your pancreas to squeeze out all the insulin. So we can't ask ourselves, well, why do I have diabetes? Why am I obese over here? Obesity over here, it comes from sugar. It doesn't come from fat. When you consume fat and you consume proteins, it doesn't make you fat. Even though fat is called fat, and this is called fat here, consuming this fat does not cause you to become fat over here. The fat over here comes from nothing other than sugar. And that's a whole different topic, maybe, like I said, maybe another date. But the point is that sugar, eating sugar in its unnatural form is very bad for you. And that's what causes inflammation and one of the causes of depression. All right, also keep another principle in mind, very, very important. Anytime you extract something when you extract something from its natural form and consume that extract, okay? Like coca leaves, okay. If you take the cocaine out of it, for example, the point is that any extract you take out becomes addictive. It has addictive potential because it shoots up, it potentiates the effect 1,000-fold, okay? And so the same thing happens with sugar. Sugar, when you consume it, when it's isolated or extracted from sugar cane, you consume that sugar, it shoots up a chemical in your brain called dopamine so high that you develop an addiction to the sugar. Okay? It's a very famous study, happened in the 70s or 80s, I believe, and it was from a group of British scientists where they were looking at diabetes and they wanted to learn the natural effect of diabetes, what happens in diabetes if it goes untreated. So they were looking for a poor country, an underdeveloped, a developing country, where they had sugarcane plantains. So naturally they went to my home country, which is India. They went to India and they went to the sugarcane fields and they studied these sugarcane workers knowing that they're consuming sugarcane year round and several times a day. And what they found after several months, even years, they didn't find nearly a single case of diabetes. Why? Because they were consuming the sugar in its natural form. When you consume sugar in its natural form, the sugar, again, it's buried within undigestible fiber and it doesn't become absorbed so quickly. Whereas if you take that same sugar out of the sugar cane and crystallize it and consume that sugar, putting in birthday cakes and pies and mitai and whatever, and halwiyat and so forth, you're going to shoot your sugar so high that it starts to inflame, like we talked about before. Your body starts to inflame. So that's very, very important. And Dr. Brogan, back to the slides here, Dr. Brogan says kind of a sarcastic statement, even feces is made from natural ingredients, right? So just because something is from natural ingredients doesn't mean that it's good for you. Even marijuana is from natural ingredients, cocaine is from natural ingredients, and so forth. Second, eliminate foods with radiation. Unfortunately, tap water in the United States is filled with radiation. I'm not sure how it is in the UK, but in the United States, if you look at cell phone towers, I'll show you a picture. Cell phone towers are usually in the water tanks. And you'll see that these water tanks, this water is receiving a lot of radiation. Second is microwave. I'll show you a very quick elementary school experiment about microwaves. If you have a microwave, throw it out. Microwaves destroy your food. When you heat food in the microwave, you destroy the nutrition. Like it says in the Quran, it's very similar that the sin of it or the harm of it is greater than the benefit. And the microwave, yeah, it saves time, but it introduces so much radiation into your food that it alters the food. Even though it's quote safe for use, it's approved by your governments to use. It's actually very unsafe. And I'll show you a quick but convincing experiment about that. Finally, eliminate foods that our intestines have not seen for thousands of years. Wheat, processed food, false dairy products. False dairy is when it's not real milk. They use milk substitutes, for example. Or it's even worse that in the United States we have milk from corn-fed cows. We're consuming corn oil. The cows are not supposed to eat corn. Cows are supposed to eat foliage and grass and clovers and so forth. That's what they're supposed to consume. And so when these cows are fed corn, what we're eating is this milk which is just very unnatural. It's not true dairy products. Here's a picture of the slides. A water tank in the United States. You see with all these these cell phone towers all around. It's all the radiation being dumped into the water. And I wonder, you see cancer institutes are popping up everywhere. I start to question, well, maybe these water tanks are creating the cancer, and then the result is you have these cancer institutes that are popping up, giving patients radiation and radiation therapy and chemical therapy and so forth. Here's the next slide. This is an elementary school experiment. It's done by, I think a sixth grader, a 12-year-old did this experiment. It's very simple. Look on the left and look on the right. We have day 1, then day 3, then day 9. You have 2 plants here. Now the seeds were planted, and these plants were grown, and then there was 2 waters. On the left, the left 3, and the microwave water was used. In other words, the water was put into a microwave, heated up to a boiling, and then the water was cooled down. And that water was used every day to feed the plants. On the right side, we have purified water. This is water that was boiled. It was boiled in a pot and then let to cool down, and then that water was used on the right. And look what happens here. On the first day, day 1, you see both of the plants growing okay. Look at day 3, you see the microwave water, the plant that was watered with the microwave water, it now starts to die out. And look at the last one, day 9, it's dead. Now, you don't need a scientist, or you don't need a physicist or a radiation specialist or a radiation oncologist to come and explain this to you. Bottom line is, don't use the microwave. It doesn't matter what this. It doesn't matter if it says it's safe and there's no radiation. Just look at the plants. If a plant cannot survive off basic water put in the microwave, that plant is dying. What does it tell you about what's happening to that water? Imagine your food. It's convenient. You come home. You don't have time to heat your food or recook the food or reheat it in a pot, clean the pot, just stick it in the microwave, take it out and eat it. That's the common sense thing to do. It's easier for you, it's easy for your spouse, etc. But look what it's doing to your body. And if you're a spouse, if your wife or husband is making this for you, your husband's responsible for murdering your cells, for putting radiation into you. I think that's one of the greatest zulm, is to use the microwave on your spouse. Those of you who cook for your spouse or prepare your food for your spouse, you're harming your spouse by doing this. And if you didn't know, well, now you do, because I just showed you the slide, so now you're accountable. Next is exercise. I won't talk much about it, but just a nice little diagram here. Exercise, it makes the brain very, very, very healthy. And I can show you slides and slides about what exercise does to the brain. It's out of the scope of this talk, but a simple exercise can reduce inflammation and remove disease and inflammation from your brain like you would not believe. The next slide talks about some of these things, that it decreases inflammation, decreases oxidation, decreases advanced hyperglycation end product. That's diabetes, basically. Exercise can cure diabetes, prevent it and cure it even. So each time the heart beats, just think about it. This is very commonsensical. Each time the heart beats, every organ in the body is washed out of toxins and replenished with nutrients, right? Each time the heart beats, what happens? It pushes the good blood, the oxygenated blood, into your organs, and then the bad blood, the deoxygenated blood, moves out, and all the waste comes out every time your heart beats. Well, imagine if you exercise and you double your heart rate. What are you doing? Basically, if you exercise for 10 minutes, 20 minutes, 30 minutes, you're putting your body through a power wash, through a car wash. You're literally washing out the toxins in your body. It's more than just losing weight. It's more than looking fit. You're really cleaning out your body, and you will look fit because of that. So exercise is very important. Rasulullah used to work out, used to exercise, aerobic exercise. Okay, not walking and going on the elliptical, etc., at a low rate, or a treadmill. He used to actually perform aerobic exercises, him and the Sahaba, 4 hours per day. 4 hours. That means aerobic exercise means you're breathing, you're sweating for 4 hours a day. That was riding the horse and training the sword. The amount he used to exercise and the amount the Sahaba used to exercise was 4 hours a day. Now imagine you go to the gym, you do a 1 hour workout, you think you did so much. Well, it's not even close to what the Sahaba did. And the Sahaba's lifespan at that time, at the time of the Sahaba, radiallahu ta'ala anhum ajma'in, most people lived about 35. 35 was the average age to when they would live. The Sahaba's lives, we know through the biographies of the Sahaba, Hayat al-Sahaba, they lived to about 60 to 70 years of age. That's double the lifespan of the average individual. And a lot of this has to do with exercise. The day you die, I'm not getting into Aqidah here, but the day you die, you know it's predestined. We all know that. But the point is, how healthy are you? number one, when you die. I mean, it's one thing to live till you're 90, but you're living in the hospital back and forth, or living in nursing homes or a hospital going back and forth. And just another thing is that even though you don't know the day you're going to die, but over a population, you can calculate it, right? Allah gave us that knowledge. So even though you as an individual, God forbid, a train might run into you today. Something could happen. Any one of us could die right now. But the point is, if you look at a population, if you have a population that has healthy habits, you'll see that the average age of that population at the time of death, meaning lifespan, will be longer or higher than the lifespan or average age of death at time of death for a population that does not have healthy practices. So if you look at the Sahaba, yeah, they lived much, much longer, and they traveled. They were very, very busy. They traveled. Most of their graves are not in their place of birth. They're outside their place. They're outside of the modern day Mecca and Medina. They're much outside of the Hijaz. You'll see where their places of death, their burials are. So the last thing, what is the ideal exercise regimen? Well, number one, 30 minutes per day, at least 5 days per week, and at least 66% of your theoretical maximum heart rate. What that means is this, and last is be consistent. It's very, very important. That means whatever exercise you do, make sure you're maintaining a heart rate that is greater than 220 minus your age. So if you're 20 years of age, if you don't want to have depression and you're 20 years of age, subtract 20 from 220, you'll get 200. Take 2/3 of that, it's about 120 to 130, 130 to 140. You must maintain that heart rate of 130 to 140 for 30 minutes straight, 5 days per week. Okay, you can have 2 days off. Most folks will go 7 days. You'll see how good you feel when you do this. The key is consistency. And Rasulullah ﷺ has said this in a hadith. I don't remember the exact hadith. Inshallah, Imam can help me. Remember the words in qalla, that in any activity you do, any act of worship, something you do that's good, but you do it's little, even in qalla, even if it's qaleel, even if it's little, but it's done consistently, if it's done consistently, has a much stronger effect. Right? It makes sense, right? If you do something, if you do a great deed, something really good, let's say you do a favor for a person, you do it one day. You come to a person, you treat them very, very nicely all day, you act like their slave, and that's great. But then all the rest of the days you do nothing. Yeah, you might be remembered. But if every single day you make sure this person is taken care of, even if it's bringing a glass of water, even if it's preparing a meal, even if it's just calling and smiling and saying, hello, how are you? Even something small that's done repetitively has a much stronger effect. And that's how exercise works. If you exercise consistently, only 30 minutes a day, not even the 4 hours that the Sahaba, radiallahu ta'ala anhum ajma'in, that they did on a regular basis, on a daily basis, just 30 minutes a day, 5 days a week, consistently, that will take away a lot of depression. Any woman who has gone through depression will tell you this. I've heard this many times from female patients. They say, I ask them when they're depressed, I say, do you exercise? They say, you know what, I used to. Oh, when did you stop? A year ago. When did you start feeling depressed? About a year ago. It's typically what happens. If you get back into exercise, the exercise takes away your depression very, very quickly. It's very hard to be depressed when your heart rate is up. If those of you are into sports, you'll never see sports players depressed when they're on the field, when they're playing a game. When the heart rate is up, they're very happy. In fact, sports players go into suicidal phases when they're taken away from the field. That's when they actually become suicidal. But those who go into depression and so forth. So the idea is to keep up exercise. It's just common sense. It's very, very important. Next one is sleep. If you look at the slide here, early to bed and early to rise makes a man healthy, wealthy, and wise. This is a very common saying, but this is the Prophet ﷺ's way. The Prophet ﷺ used to say, sleep early. Sleep early and wake up early. Okay, early to bed and early to rise. That's what's important. Keep in mind the midnight rule. This is very, very, very important. If you take home anything from this, aside from exercise, take home this second rule. Every hour of sleep before midnight equals 2 hours of sleep after midnight. In other words, if you sleep at 9 p.m., then just by midnight, you already have 6 hours of sleep. That's the effect, right? And if you sleep after midnight, you can never make that up. If you sleep at midnight or from midnight or later, no matter how you can sleep 10 hours, you will feel groggy. You will never feel the same. The most refreshing sleep is from before midnight. That's why it's said to sleep no later than 11 p.m. After daylight savings, and then before that, 10 p.m. Okay, when the days are shorter. So you want to make sure you sleep at least 1 to 2 hours before midnight. If you sleep at 9 p.m., you are so refreshed. You can wake up 3 a.m. and you're much more productive the next day. And I don't care who you are, no matter how intelligent you are, no matter how efficient you are, how quick you are, you will be even quicker and more efficient if you sleep before midnight. This is very important, especially in I don't mean this as a racist term, but me being Indian. I was born and raised in America, but my blood is Indian, my culture is Indian, I'm from India. And in India, this is a big problem, at least amongst the Muslims I can see, is that Muslims usually sleep at midnight, 1 in the morning, 2 in the morning. And that's not a good practice. That's not a good practice at all. If you sleep early at 9 p.m., 8 p.m., you can have more fun the next day, you'll be more productive, and you have just as much even more enjoyment because your health will be better, and you don't develop depression. Depression comes from lack of sleep. That's one of the most common causes of depression is lack of sleep. And then the depressive symptoms keep you up again at night as well. Relaxation, there's yoga, tai chi, meditation, for example, just some things you can do. As long as you're doing them on a daily basis, Dhikr and meditation is a different topic I won't talk about now, but actually I think I do have a little bit on it with Ala bi zikrillahi tatma'innul qulub from Surah Al-Ra'd, inshallah, the ayah on that. So the key is be consistent. Okay, at least in America I know for sure, and probably in the rest of the world, there's this challenge thing that goes around on WhatsApp groups and social media. Challenge, let's do the diet challenge, the no carb challenge, exercise challenge. It's like a fad. What challenge does, it steals all your himmah. You see, all your himmah is gone. It's challenge. Okay, I'm going to do this for 10 days. For 10 days, I'm going to eat like the Prophet ﷺ. I'm going to eat very, very modestly. Then what happens after 10 days? After the 10 days are done, you go right back to how you were, and you go even worse, and you believe you're entitled to it. Because you made the sacrifice for 10 days, now you're going to treat yourself to some fun. So what point is that? That's a zulm on your body. Your body is an amana. I don't mean to turn this into a khutbah, but I'm saying that your body is an amana from Allah. You're going to be accountable for your body. ثُمَّ لَتُسْأَلُنَّ يَوْمَئِذٍ عَنِ النَّعِيمِ. You'll be asked about every single ni'mah. Your body, your eyes, your skin, your hair, everything is a ni'mah you're given. You're going to be asked about it. And to say, I'm going to do this challenge, I'm going to starve myself for 10 days, I'm going to lose all this weight, I'm going to look really great, and then what happens after that? You do dhulm on your body again, right? You go back to how you were and even worse. So be consistent. That's what's important. Again, the Muslim is consistent. The Muslim starts what they finish. The true Muslim starts a good practice and never looks back. If you start a good practice, say, I'm never going to eat processed food, do it forever. Don't do it for 40 days. Don't do it for 90 days. Don't for 120 days or 1 year. Do it forever. We don't need New Year's resolutions. Okay, Muslims don't need New Year's resolutions. Make a resolve. Focus your himmah on one practice and say, I'm going to do this good practice for the rest of my life. And keep it that way, and you'll see you'll be a lot more successful. And when you're able to do that, you'll develop the himmah and you'll develop inshallah, you get the tawfiq of Allah to continue this and add on better habits even onto that as well. Next is a prayer. Verbalize the problem, doing something about the problem, thinking of solutions. Prayer is something beautiful. Whether you're Muslim or non-Muslim, prayer always helps. And many books are written on this. It doesn't matter who you even pray to. Just praying, just make dua for your problem. Right? We make dua for things we want. We usually make dua for money. We make dua for sometimes mostly for our children and so forth, and in our families and so forth. But if you have a problem, make an immediate dua for it. Okay, that's what's very, very important. Make a prayer for it, because when you make the prayer itself, you'll bring down a lot of barakah. Just the fact you're doing something, you're putting your hands up to Allah and asking, the tawfiq will come, inshallah. You'll have a lot of solutions to start to come about it, and even just verbalizing. You say, Ya Allah, this is the problem I'm having. Just by verbalizing the problem itself, you'll see the solution starts to come very, very quickly. We have a clinic in Cleveland. It's called the Higher Health Clinic. It was based actually off Sheikh Nuhamim Keller. He had a course called the Higher Health course, which I attended, and I took some of the principles from there. I'd already studied Eastern medicine, but I took some of his principles and I applied it. So we have Yunus alayhi salatu wasalam. It's all of you know his story. I'm sure most of you know this story. Every Muslim knows the story about how he got into trouble on the boat and then he was flung off the boat, right? And what was very important about this is, what's the relief, the key to relief from all hardships is, La ilaha illa anta subhanaka inni kuntu minal zalimin. Most of us know this dua, we know this ayah, we know this prayer. It's a very, very powerful dua. But what's most important about this dua is this last part, inni kuntu minal zalimin. Means the cure to depression lies in you taking responsibility. Okay, you have to take responsibility. Meaning where depression cycles, where depression gets worse is when you believe someone else did something to you. Okay, the way you cure depression, the trick to curing depression is this, inni kuntu minal zalimin, I'm the zalim. Okay, I'm the one. Even if you believe that you're not, make believe that you are. Make believe you're the zalim. Now you think about Yunus alayhi salatu wasalam, if you think about him, he was in the whale's belly for how long? Right, for days, for 40 days. Imagine his cortisol level. And when you wake up in the morning, the most important thing that comes in the morning is the sunlight. Allah has created the sun in a way that the light, it hits a place in your brain called the suprachiasmatic nucleus. It's in the hypothalamus, and it sets off a cascade of these hormonal changes in your body that just wakes you up. And try it. If you wake up in the dark and you're really sleepy, your eyes are squinting closed, just go to the window, open the window, look up at the sun. Look in the direction of the sun, and you'll see you wake up suddenly. That's a chemical reaction in your body. It's a natural chemical reaction. It's one of the great ni'mas of the infinite ni'mas of Allah to create the sun. And then He وَسَخَّرَ لَكُمُ الشَّمْسَ وَالْقَمَرَ. He subjected the sun to you. This is one of the ways. The taskhir of Allah, that Allah subjected the sun to us, is that the sun, our bodies are designed in a way that the sun can wake us up and cause a lot of positivity in us. Now imagine Yunus alayhi salatu wasalam, he was without sunlight for 40 days. Imagine the depression he was in. If you think you're depressed, you think you're sad, imagine what he went through. And what did he say? Did he complain? Did he say, oh, look what they did, they flung me off the boat. Oh my Lord, look what they've done to me. No, he said, Inni kuntu min al-zalimin. I'm the zalim. He didn't blame anybody else. Where was his food? When you're in a whale's belly, where's the food? You're at the mercy of what the whale eats. Whatever the whale is going to eat, the whale eats some kind of fish. Maybe you can eat that fish, maybe you can't eat that fish. When do you receive any kind of fresh air? Well, the whale has to go up. Imagine the whale has to go up to the top, a surface of the ocean, and then come out of the ocean, breathe, and come back in. That's when he's going to have air. Imagine the fresh air coming in. Imagine the lifestyle he had. That was serious, serious depression. He had no family, he had no friends, no one to talk to. He was just in darkness. And he made this dua, so much so that the angels, as you know, they heard the dua coming from 3 different layers. They reported to Allah that they heard a dua coming from air, then through water, and then to air again. It's a very special dua. But the point of this dua is the last part, Inni kuntu min al-zalimin. Take, no matter how much you believe you're a victim, take responsibility. Say, no, I'm not the victim. I'm the one who screwed up. And you will find out that, inshallah, if you're able to do that, to the nur of Allah, you'll find out that, yeah, you actually were the problem. And often when we believe we're the victim, we're actually the problem. We just don't realize it at the time. I don't want to go too much on a tangent, but that's the important part here. So the next slide, the top of it says, take responsibility. Take responsibility even when it is not yours. That's the key. That's what's very, very important. Now beware, the nafs craves depression. Okay, depression, why? Why does the nafs love depression? Well, depression leads to victimization. As soon as you're depressed, you start to believe that you're a victim. And once you believe you're a victim, then you believe in entitlement. Anyone who believes they're a victim, if you feel like you're a victim, you now believe you're entitled. Meaning now you deserve. And you can go beyond the bounds to get what you want. And what happens next is sin. Okay, this is one of the best tools of shaitan. Shaitan's one of Iblis's favorite tools is depression, because it leads to sin, and that's how it does it. When you feel down, you feel you're a victim. When you feel you're a victim, you feel you're entitled. When you feel you're entitled, you start to sin. And you'll see this. Anytime you become depressed or you feel sad, you immediately walk outside of Sharia. You may never use profanity. You don't use bad language. You become depressed, you become victimized, someone hurts you, you feel entitled, you start to use very strong language. You start to hurt other people. You start to scream at people. In fact, you'll see in times of anger and depression, you will say things that you never thought you would actually say. In fact, this is a real problem with women more than men. And there's a hadith of Rasulullah sallallahu alaihi wasallam. He said that in Jannah will be mostly poor people, because their hands are always up, they're making dua, they're always asking from Allah. So the mostly impoverished ones will be the ones in Jannah. In Jahannam will be mostly women. Now I don't mean this to be a misogynistic talk or anti-female talk. I don't mean that at all. I'm just saying what the Prophet sallallahu alaihi wasallam said. And in another hadith, he clarified what that means. He clarified that the reason this is the case, why is Jahannam mostly filled with women? It's because when women get angry, they say things Allah doesn't like. Okay, when women get angry, they say things Allah doesn't like. And that happens more so in women than men. The man's fitna is the hands, physical. The woman's fitna is the tongue. If you don't believe me, just get married. You'll see very quickly. The man's fitna is the hand, the woman's fitna is the tongue. And so when women get angry, I mean this as something constructively. Okay, men and women need each other. Okay, it's a symbiotic relationship. They're both blessed. Adam needed Hawa, and Hawa needed Adam. The point is, I don't mean this as something misogynistic. What I'm saying is that this is the fitna you have to watch out. And depression, remember one of the first slides we showed, women suffer from depression twice as much as men. And you'll see that the problem comes from the tongue. If the tongue is controlled, you control your tongue, you can save yourself a lot. And again, men have this problem as well, but this is something you have to be careful of with women. All right, so what is the real cure for depression? This next slide is another take-home message. The real cure is shukr, shukr, and shukr. There's one ayah in Surah Ibrahim, بعد أعوذ بالله من الشيطان الرجيم وإذ تأذن ربكم لئن شكرتم لأزيدنكم ولئن كفرتم إن عذابي لشديد. This ayah is, out of all the ayahs of Quran, this ayah is one that touches the heart very, very deeply, because Allah is swearing on Himself here. So when He said, it says, وَإِذْ تَأَذَّنَ رَبُّكُمْ, when your Lord proclaims, لَإِن شَكَرْتُمْ. Those of you who studied Arabic, the lam there in لَإِن شَكَرْتُمْ is a lam al-qasam. It meaning it's the lam where Allah is like billahi, wallahi, tallahi. This lam is Allah swearing on Himself. You know, Allah swears on the sun, وَالشَّمْسِ وَضُحَاهَا وَالْقَمَرِ ذَاتِ اللَّهِ. He swears on different creations. But here Allah is swearing on Himself. He's giving you a promise that لَإِن شَكَرْتُمْ, if you give thanks, if you thank Allah for something, لَأَزِيدَنَّكُمْ, He most certainly will increase you. All right? إِنَّ اللَّهَ لَا يُخْلِفُ الْمِيعَادَ. Allah never goes back on His promise. We do. Most of the time, we do. Allah doesn't. Allah is promising you, if you give shukr, if you give thanks, He will increase you. And I believe, and I've seen this with Muslims and non-Muslims. In non-Muslims it works. It doesn't even matter. It's interesting. It doesn't even matter what God you worship. Even the non-Muslims, when they give shukr, when they give thanks and gratitude, depression goes away very, very quickly. And there's actually a scientifically proven impact on the genes. There's a gene, I'm forgetting the name now, it's a 5-letter name, it starts with H, but there's a gene that it actually changes what, it changes the telomeres or ends of the chromosomes change in response to gratitude. It's very interesting. So when you give gratitude, your body actually changes. And I believe that's a blessing, that's a manifestation of the blessing of this ayah or in the Quran. لَإِن شَكَرْتُمْ لَأَزِيدَنَّكُمْ. So if you go to the bottom of the slide, here's a very simple regimen that I've seen. It's an absolute cure for depression. But it only happens with the tawfiq of Allah. If Allah gives, Allah yuwaffiq alayna, if Allah gives us the tawfiq, this can happen, otherwise it won't. And what happens here is, when you first open your eyes after sleep, so when you wake up in the morning, after you open your eyes, let your tongue explode with shukr for anything and everything that you can think of. Okay, let your tongue explode for anything and everything you can think of. In other words, you're laying in bed, your eyes open. Don't worry about your money, don't worry about your job, don't even worry if you're late to work. Don't even look at the time, just your eyes open, start giving shukr for everything you can think about. Give shukr for the good, for the bad, for things in nature. In fact, when you do this, inshallah, many patients have said this, that when they do this, every day new items come to mind. And that's tawfiq from Allah. The nur of Allah will come on you, inshallah, and Allah will show you. The nur is light. It will show you. You get out of the zulm, out of the darkness, you'll start to see then what you have not been appreciating. You start to appreciate your spouse. Even if your spouse is an absolute pain to live with, an absolute bear in the home, you'll appreciate them because of the good things that come from the spouse. And the good things that come to you, that your character and how you develop from your spouse and so forth. It's very, very important. So the shukr is something which is, it's a great, great, great blessing from Allah that we're able to give shukr. In fact, you give shukr for shukr. You give shukr for Allah giving you even the shukr itself. Give shukr for this ayah, shukr for recitation, shukr for the Quran, for the angels, for the al-qadr, for Allah's kun, for the kaun, for whatever it be. You give shukr for as many things as you can. And you'll see how long it'll take you. Some patients have come back and said, I go 15 minutes. Some say 1 minute. Some say half an hour. Whatever it is, I will guarantee you one thing. No matter how much time and anyone will guarantee this, that no matter how much time you spend giving shukr for something, you will never complain that I missed something in my day because I spent too much time on shukr. In other words, you spend 30 minutes giving shukr to Allah, you won't miss anything. You won't say, because of those 30 minutes, I was late to work and I lost my job. And none of these things happen. In fact, everything works in your favor if you start the day this way. I would even say to end the day this way as well, with shukr for whatever happened in that day. Give shukr for the good, give shukr for the bad, give shukr for everything. I believe that is the true cure for depression. And like I said, this works for non-Muslims. Can you imagine what it'll do for Muslims? Right? Imagine it works for non-Muslims, it works for idolaters. What is it going to do for Muslims? Imagine. And this is not much. This is cost-free, no side effects except you'll gain hasanat. This is something which is a very, very, very great blessing. That's something we cannot ever be thankful enough for. In fact, it comes to you come to the many patients have come back saying that, it comes to the point where I start crying, I'm giving so much shukr that I say, what's the point? Meaning I can never truly thank Allah for what Allah has given us, so why should I even give thanks? And that's a good thing. When that comes, you should continue to give thanks, but it's a good sign. It means, you're getting it. It means you're getting the point that we can never truly be grateful to Allah. This blessing is not for Allah. Nothing happens to Allah if we give thanks. It happens to us. The blessing is for us, and that's the idea. So one last slide, I believe. It's a little challenge. It was inspired by a talk by a sheikh, a challenge. Try this out. Give up complaining. Don't complain. Try this. It's a challenge. Do it for 40 days. I put this as a joke because we're all into challenges and challenges. All right, let's try this challenge out for 40 days. Instead of your carb-free diet for 40 days, I'm going to walk to work and ride my bike for the next 40 days instead of driving. Forget those challenges for now. Try this challenge out, okay? We'll go back to the slide. Every time you complain to someone that cannot do anything about the situation, catch yourself and write it down. It's self-hisab. In other words, when you complain to someone about something and that person can't do anything, in other words, if you say, for example, God, it's so hot outside today, well, that person can do nothing about it, right? Unless you're in the house, they can turn on the AC, but they can't change the weather. Or if you start complaining, I can't believe I lost my job. I can't believe this happened. I can't believe I lost my money. I can't believe I left my baggage at the airport. You can complain and complain and complain all you want, but if the person can't do anything about it, then what's the point of complaining? And so the challenge is this. Every time you do that, write down, catch yourself, take a piece of paper, keep a piece of paper with you, write down on that paper what you complained about in a few words. I complained about leaving the baggage at the airport, or forgetting to wake up my friend this morning to join me at golf. Whatever it is you complain about, write it down. And then what you do is you run to the sink. You make your wudu, and you pray 2 rakahs of nafil salat. And in that salat, you try to cry. Okay, you try to actually cry because how stupid you are for complaining and being ungrateful to Allah by complaining about something to someone who can't do anything about it. And then when you're done with your salam and salam, you'll then take it and throw it away in the garbage. If you do this 2 or 3 times, it starts to become such a pain to do, you'll stop complaining. And when you stop complaining, watch what happens to your life. Watch what happens to your depression, watch what happens to your symptoms. You will be absolutely amazed that you find that complaining does nothing. It does nothing but annoy you and annoy everybody else around you. In fact, complaining when nothing can be done about it is a zulm on yourself and everyone else around you. If you complain, for example, there's not enough salt in the rice, that's okay, because then you can put more salt in the rice, or whoever's cooking, they can put more salt in the rice for you. That's okay, that doesn't count. But if you complain about something that, why do we buy this brand? Oh, this brand is horrible. This rice is horrible. Well, you can't do anything about it now, right? Unless you go buy rice yourself, go cook it yourself. Instead of complaining about the cook, you do it yourself. You learn to cook rice yourself, then you won't have that problem anymore. So again, the solution's in you, and that's the idea. I think we're done with the presentation, but my iPad is turned off here. Can you go back to the slides? Well, that was the end of the presentation. Looks like maybe the battery ran out on this. Sorry? Well, that's fine.
Jazakumullah khair. It's been very informative presentation and detailed, you can say, explanation about the depression, covering all the stages, mashallah. It's been, for the first time, I would say, on IQRA TV, we have had such in-depth analysis, mashallah, of this, you can say, whether you call it symptom, whether you call it signs, whether you call it cause or reason or whatever, but definitely it's not illness itself. So mashallah, such a great detail, alhamdulillah, may Allah subhanahu wa ta'ala reward and bless Dr. Tanvir Syed, mashallah, for presenting this excellently. Jazakumullah khair. And mashallah, you have touched in greater detail on the solution, how to avoid depression. Subhanallah, fantastic, mashallah, jazakumullah khair. And I don't think we have enough time for Q&A, question and answer. We have only few minutes remaining to end this program. If there is anyone who would like to ask any question, we might be able to take just 1 or 2 calls. But if you would like to call us, inshallah, this is your moment. You can ask any question, inshallah, on this topic. Day after tomorrow, day after tomorrow, on Friday, Dr. Tanvir will be in Bradford studio. We will be speaking from there, inshallah, and the topic is everyone's favorite topic, magic. Just give a 2-minute summary on the topic what you will be discussing on Friday at the same time on the same channel, 7 to 9 p.m. and why people should watch it, inshallah.
Inshallah, bismillah, yes, again, thank you for having me. Inshallah, yes, on Friday we'll be talking about 4 evil elements. One is magic, The second is the evil eye, or the nazar, or nazar they call it, or al-ain. The third is hasad, or envy, and the fourth is jinn. And although these four evils are very real, they're real elements, they do exist, I believe that they're overly blamed for a lot of problems. And most of the problems comes from ourselves, comes from the nafs. But I would like to do a nice, inshallah, detailed expose of what the source of these evils are and how they're exploited into business. It's usually exploited by way of business and money and gain, and what the cure and prevention and treatment actually is, similar to what we did today with depression.
MashaAllah. So I request as many people as possible to try to attend this program in Bradford Studio, Friday, 5th of July, 7 p.m. till 9 p.m. inshallah. We will be doing live program inshallah from Bradford Studio on Manchester Road inshallah. Let's take one telephone call very quickly. Hello, Assalamu alaikum.
हेलो
जी, अस्सलाम वालेकुम.
हाँ जी, क्या हिंदी में बात कर सकते हैं क्या?
जी, कर सकते हैं.
हाँ जी, हमें आपसे ये पूछना था, हमारे एक करीबी बहुत ही बच्चे को ये बहुत दिक्कत है कि वो बहुत बच्चा, अभी 21 साल 22 साल का बच्चा है, लेकिन बहुत उदास रहता है, हमेशा रोता रहता है कि मुझे कुछ अच्छा नहीं लगता. हमने उसे साइकियाट्रिस्ट को सबको दिखाया, पर हमें कुछ नहीं. यहाँ पर इतना महंगा है कि हमें नहीं पता डिप्रेशन का कराएं.
Right, you understand the
Yeah,
question?
how old is the patient?
About 10 years. कितने 10 साल का बच्चा है ना?
नहीं, एक केस
21,
पर
21.
लड़की, जैसा डॉक्टर साहब ने कहा भाई लड़कियों को ज्यादा है, मुझे भी लगता है कि सही बात है कि शायद वुमेन
What I'd strongly recommend is 21-year-old boy, is that correct?
That's right.
Okay. What I'd strongly recommend is get his vitamin D level checked. Vitamin D, it comes from sunlight. Sunlight hits the skin and causes a chemical reaction, and that goes into vitamin D. It's very important. That's number one. If vitamin D levels should be between 40 and 60, usually, especially in cultures like our cultures where we don't spend time in the sunlight, because of modesty, we keep our skin covered and so forth, we don't receive much sunlight. And interestingly, in the time of the Sahaba and even after, many of the homes, they had courtyards, meaning the women could sit in the courtyard in the house and sunlight would hit them. They didn't have to wear hijab because they were around the mahram, so they could do that. So sunlight was never a problem. Nowadays, the houses are created differently, and plus we live in places where there's not much sunlight sometimes, and so we don't receive that sunlight. So we have to supplement our vitamin D with milk as one way to do it, but that's not always the best formulation. What I would recommend is get a vitamin D level, number one, and then number two, then start taking the supplement. You can take 50,000 units, 50,000, 5 and 40, 50,000 units once a week for 12 weeks. Check it again. The second thing I would recommend is that the brain is made up of fat. Okay, 70% of the brain, if you take the brain and put it on a scale, 70% of the brain is pure, the weight is fat. And 20% of the brain is actually cholesterol, okay? So cholesterol, I mean, you don't need a neurologist to tell you that cholesterol is the most important dietary element. You need cholesterol in your diet. Now in 1958, a big lie was told, a big lie. The lie was that cholesterol, when you eat it, it clogs your arteries and causes a heart attack. And this is not true. This is a complete lie. And now, in fact, the American government about 4 years ago has removed cholesterol from the bad list. It's no longer bad, something considered bad. Cholesterol actually cleans your arteries and it fixes your brain. But my point is this: the brain is made up of fat and cholesterol, which means your mood, how happy you are, how sad you are, and how you think, it all comes from the fats you eat. If you don't eat the proper fats, you'll develop psychiatric symptoms. I didn't talk about this on the talk, but the point is that you have to keep fat and cholesterol in your diet. So look at his diet, increase the fats. And what I mean by that, it depends on what country he's from. If you're speaking Hindi, so from India and Pakistan, you have to have coconut oil. It's very important. Coconut oil is very important in your diet. You have to have the pure coconut oil is very important. Ghee is very, very, very important. Okay, you want the most natural ghee you can find, organic type of ghee. That's what you want in the diet. That has to be. Don't get the dalda, vegetable oil. That's all garbage. You're poisoning the brain with vegetable oil and these things. Olive oil is good, ghee is very good, and coconut oil. Get the fats back in the diet. The third thing is exercise. He has to exercise. He's 21 years old. He should be able to run or jog or do something, weight lift, do something for at least 30 minutes per day. Even if you have the whole family do exercise together. I think if you try these three things out, get the vitamin D level checked, get the diet, fats, olive oil, ghee, and coconut oil in the diet, and the third is exercise every day, at least 30 minutes. I think you'll be amazed as to what he can do. Actually, one fourth thing is get rid of the cell phone. Dump the cell phone. Usually depression comes from the social media. Our brains can only handle the person in front of us, but when we're on the cell phone, we're handling, if you're handling for work, it's one thing, but if you're handling socially, you're talking to 50 people at the same time, it's going to mess with your brain. That's not the way to work. For work is okay because you're actually doing something, you're actually accomplishing something, not socializing.
Right, mashallah, jazakumullah khair. तो उम्मीद है कि आपका जवाब मिल गया होगा. We'll take next call very quickly. Assalamu alaikum wa rahmatullah.
Wa alaikum assalam.
Yes, brother, what you would like to say?
I'd just like to ask a question. My sister, she's 50 years old and she has damage on her stomach lining and she finds it very difficult to digest food. What would you advise for that?
Sorry, I didn't hear. How old is she?
6.
50.
6 years old. And what happened, you said? What happened to her lining?
She says that her stomach lining is damaged and she just has problems digesting food, all sorts of foods. She's for about a year and a half now.
How is it damaged?
There's been no diagnosis of any disease. First thing we think it's Crohn's, and then it wasn't Crohn's. They said we think it's something else. It wasn't either. So there's been no diagnosis yet. I
got you. Yeah. What I would recommend there's something called bone broth. Okay, bone broth. So if you take, in fact, I don't know your nationality, but most ethnic cultures know how to do this. Actually, even in America, it's common, the bone broth. But what you do is you take the bones, whether it's chicken bones or whether it's lamb or beef, whatever best digest. Chicken is probably easier. And you have to cook them in a pressure cooker 4 or 5 hours or even overnight. Minimal spices, maybe just put some black pepper maybe and some salt, not much, even just some salt is fine. And consume the broth every day. It's very, very easy to digest. It contains all the fats and proteins you need. It's very, very healthy for you as well. It has the vitamins and minerals you need. I would start with something very, very simple. Let the gut heal itself. Okay, so you want to stick to, I think bone broth is very, very important in the diet. Then beyond that, stick to fruits and vegetables in their natural form. You have to boil them to make it easy to digest. So boiled vegetables and some fruits that are very easy to digest. What's also very good for inflammation in the gut, it's called custard apple. There's 2 types. There's one called cherry moya, and the other one is called chiku sapota. It's in India, Pakistan. In India it's available. I don't know what Pakistan, India it's available. These fruits are very, very good. It's like a custard. It tastes like a custardy apple. When you eat them, they actually fix the entire lining of the gut. They cure these inflammatory diseases. In fact, there are cases of colon cancer. Many cases actually of colon cancer, where the custard apple was eaten for days and days and days, I think along with Zamzam water, if I remember correctly, and it actually cured the cancer as well. I would try these simple foods. It's out of the scope of this talk, otherwise I could talk more. I don't want to go too long, but I would start with these 2 simple dietary supplements, or not supplements, actual diet, meaning that these are the main substances she can consume, and then see what happens from there.
MashaAllah, Jazakumullah khair. And we have one more telephone call very quickly. Let's move towards that. Assalamu alaikum.
वालेकुम अस्सलाम
जी.
मैंने सवाल करना था. इनका लेक्चर मेरे हस्बैंड ने सुना. उन्हें 30 साल से स्किफीनिया पैरानाइड है, और अब उन्होंने क्या कहते हैं, इनका लेक्चर सुन के वो कहते हैं मैं अपना इंजेक्शन और अपनी टैबलेटें बंद कर दूंगा. तो आप बताएं कि मुझे क्या करना होगा. और यानी वो कहते कि मुझे, यानी उन्होंने कहा कि टैबलेटें वर्क नहीं करती हैं, मगर जब ये टैबलेट और इंजेक्शन नहीं लेते हैं तो ये बहुत ज़्यादा बीमार हो जाते हैं.
Yeah, so the problem here, inshallah, Imam Qasim will translate to Urdu if needed, but the problem here is that he has, so what you're saying is that he has symptoms of depression, symptoms of paranoid schizophrenia, and he's been taking medications now for a long time, for many years, and now listening to my presentation, he wants to come off the medications. Number one, that is very, very dangerous. Do not come off the medications. And the reason is because those medications that are used to treat paranoid schizophrenia, They work through a chemical called dopamine. Some other chemicals as well, but the main chemical is dopamine. The problem here is this. Dopamine is very important to make us function properly. And if you take these chemicals, and these chemicals are that you're taking, these drugs, they're blocking the dopamine, your brain is completely different now. Your brain needs these drugs. Okay, unfortunately, these drugs have become part of you. So you can't just come off them. If you're going to come off them, you have to do that through a psychiatrist. But from my experience, if you have paranoid schizophrenia and you've been taking drugs for years, I don't believe you can ever come off the drugs. That's different from depression. Depression you can, but not paranoid schizophrenia. Paranoid schizophrenia, if you've been taking drugs for many years, you unfortunately have to stay on these medications. So again, do not come off the medication, stay on them. If you want to come off, you can, but you have to do it through a psychiatrist, or you can go to a psychiatrist who also works with naturopathic medicine, natural treatment, or Islamic medicine. That can happen. But like I said, unfortunately, if it's been 30 years, I'm being very frank, and don't mind my frankness, I don't think there's any way you can come off the medications.
Right. So basically, I mean, in your presentation, you have explained the harm and dangerousness of these medicines, and maybe that's why he wants to come off it.
Of course, yes. Yeah.
So by continuing the medication, isn't it making it worth less effort, or?
Well, the problem is that
making problem even bigger?
Yes, you're right. The problem is that you've been taking the medication for so many years, your brain now depends on that medication to get that chemical. And so the medication now it's become part of you. You can't, after 30 years, you can't come off it. That's number one. The second, the talk was on depression. That you can come off of. There are problems when you come off, but you can come off these things. It's possible. It takes some effort, but you can do it. If you do the diet, the exercise, sleep, and so forth. The problem with paranoid schizophrenia, it's a different part of the brain that's involved. And it's very, very sensitive. And coming off the medications can put you into such deep psychosis that you can actually kill those around you, kill yourself. You can cause a lot of problems for yourself. You can end up in jail, end up in prison. So it's best, that kind of disease is a little different. If you've been taking, unfortunately, for so many years, just stay on it. I wish I had met this patient 30 years ago. And when the symptoms started, then you don't need medications. You can actually cure it very quickly with the right techniques, with diet, exercise, and dhikr and so forth, and sleep. But unfortunately,
so
after
can
30
there be
years,
a combination now that slowly he can come off the medication?
Yes, that's why I was saying that go to both. Go to the psychiatrist, tell them you want to come off the medication, but also work with a healer, with an Islamic healer, someone who's well versed in naturopathic medicine, who knows about the herbs, who knows about these natural chemicals you can use.
Like Hakim and like that.
Exactly, yeah. Then it's possible, but like I said, I don't want to give false hope. After 30 years, it's not easy to do. And the problem here is not the patient, it's the wife. The jihad is on the wife, because the wife has to deal with the patient who is a husband who is the husband is the wife's Jannah, and so she has to be obedient to a husband who has paranoid schizophrenia. MashaAllah, may Allah give her tawfiq. That's amazing, and that's her Jannah, inshallah. I mean, that's not easy to do. Not easy to do.
MashaAllah, Jazakumullah khair. तो उम्मीद है कि आपका जवाब मिल गया होगा कि आपके शौहर जो कह रहे हैं कि वो दवा छोड़ना चाहते हैं, चूँकि उनकी जो बीमारी है वो एक स्पेसिफ़िक किस्म की है कि नॉर्मल डिप्रेशन नहीं है, तो इसलिए वो जो है दवा छोड़ने का मशवरा हरगिज़ नहीं होगा, बल्कि ये कि साथ में वो साइकेट्रिक को मिलें, उनसे मशवरा करें और साथ में किसी हकीम या यूनानी या अल्टरनेटिव मेडिसिन को लेने का शुरू करें और आहिस्ता आहिस्ता फिर जो है उसको एडजस्ट करें कि उन दवाओं को कैसे कम किया जा सकता है और दूसरे तरीक़ों को कैसे अपनाया जा सकता है इंशाअल्लाह। तो दवा छोड़ने का मशवरा हरगिज़ नहीं रहेगा। चलते हैं नेक्स्ट कॉल की तरफ। अस्सलाम वालेकुम। जी अल्हम्दुलिल्लाह।
मैं पूछ रही थी कि कभी वो प्रोग्राम सारा शुरू से स्टार्ट किया, पर अपने बात आई थी कि बाज़ दफ़ा हम लोग टेबल जो बटर यूज़ करते हैं तो वो क्या है, दूसरा सही जब बटर है तो उसको हम लोग सलाद तो भी बनाते हैं घर में, तो वो भी ठीक है। और तीसरा ये है कि मैं डायबिटीज लेती हूँ, इसका क्या नाम है, चलो आप तो दवाई लेते हैं, दिमाग खराब हो गया, अभी बता रहे थे कि वो मैं लूँ कि छोड़ दूँ। तो देखे एक तो वो सुबह लेते हैं डिप्रेशन के लिए और रात को कोलेस्ट्रॉल, तो कोलेस्ट्रॉल की दवाई डॉक्टर मुझे नहीं छोड़ने देता, कहते हैं कि 22 मिलीग्राम की है, तो कहते हैं डेली इसको दो।
हमें आपकी आवाज़ जो है ना बहुत ही कट कट के आ रही है जो है।
आपकी आवाज़ आपकी तरफ से मुझे बेस की आ रही है, आवाज़ वापस आ रही है।
जी, आप ज़रा आहिस्ता बोलें, दोबारा रिपीट करें आप क्या कहना चाह रहे हैं।
मैं कह रहे थे कि हम लोग बाद दफ़ा वेजिटेबल बटर यूज़ करते हैं, कहते हैं तो वो अगर वो यूज़ करें, अगर वो उसको छोड़ के अगर हम लोग बाद
नहीं सुने, आपकी आवाज़ बिल्कुल हमें समझ नहीं आ रही जो है। आप फ़ोन रख के प्लीज़ दोबारा कॉल करें, चूँकि लाइन में कुछ गड़बड़ी है, तो आप प्लीज़ दोबारा कॉल कर लीजिए। हम प्रोग्राम को चाहे एक्सटेंड कर लेते हैं, आपकी कॉल का वेट करेंगे इंशाल्लाह। चलते हैं नेक्स्ट कॉल की तरफ। अस्सलाम वालेकुम।
अस्सलाम वालेकुम।
वालेकुम सलाम व रहमतुल्लाह।
जी मैं उर्दू में बात कर सकती हूँ?
जी कर सकते हैं जी।
मेरी आवाज़ ही रिपीट हो रही है दोबारा,
नहीं,
मुझे आवाज़ आ रही है।
हमें आपकी आवाज़ साफ़ आ रही है जी, बोलिए आप।
जी मैं ये कहना चाहती हूँ कि मेरी बेटी को 25 साल से डिप्रेशन है। अभी इससे पहले एक और कोई कॉलर थी तो उनके बारे में आपने सही जो कुछ बताया वही बीमारी शिज़ोफ्रेनिया है मेरी बेटी को भी। तो
क्या बीमारी है?
शिज़ोफ्रेनिया वही है, डिप्रेशन है।
ठीक है।
वो कई सालों से उसको डिप्रेशन है, जिन्हें 25 साल हो गए हैं, तो वो मेडिसिन खाती रहती है। इंजेक्शन है एक पेरी डॉन इंजेक्शन लेती थी तो वो ठीक रहती थी, थोड़ी सी सेंसिबल थी, तो अब वो छोड़ दिया, स्टॉप कर दिया। अब उसके बाद एक एरिपेरिजोल एक टेबलेट है 15 मिलीग्राम की, वो एक ही लेनी होती है, वो भी वो रिफ्यूज़ करती है। वो कहती है कि मुझे नहीं चाहिए, मैं ये ड्रग है और ये है वो है। तो वो ठीक नहीं रहती, वो गुस्सा उसे बहुत ज़्यादा आता है, बहुत ज़्यादा गुस्सा आता है उसे। तो मुझे ज़रा बताएं कि इसको विटामिन डी की ज़रूरत है, क्या खाना चाहिए, क्या करना चाहिए। वो मैं अकेली होती है तो मैं इसकी लुक आफ्टर करती हूँ, बहुत ज़्यादा गुस्से में होती है, मैं बहुत ज़्यादा परेशान हूँ। अगर मेरी को मदद कर सकते हैं, हेल्प कर प्लीज़ मुझे बताएं मैं क्या करूँ।
जी आप कहाँ पर रहते हैं आप?
लंदन में।
राइट, ओके। खैर जो है चूँकि हम ब्रैडफोर्ड जा रहे हैं तो इसलिए मैंने कहा कि अगर आप उस इलाके में हैं तो वहाँ मुलाकात हो सकती थी। बहरहाल जो आप कह रही हैं विटामिन डी का, वो आप सवाल कर रही हैं या बता रही हैं कि विटामिन डी की उनको कमी?
मैं पूछ रही हूँ कि क्या ये सही रहेगा विटामिन डी का इंजेक्शन से देखो कमी होगी विटामिन की, या कई सालों से इसको डिप्रेशन है, इसके हस्बैंड ने इसको छोड़ा तो उसके बाद ये ठीक नहीं है।
जी नहीं, जो तनवीर ने पहले मशवरा दिया ना, वो विटामिन डी चेक कराने का कहा है, ये नहीं कहा कि डेफिनेटली जो है विटामिन डी कम है। डॉक्टर तनवीर ने ये कहा है कि आप विटामिन डी चेक कराएं, तो आप आई गेस शी कैन आल्सो डू सेम जो है।
एग्जैक्टली, आई थिंक
जो एक टेबलेट लेती है तो इसके बजाय वो इंजेक्शन उस पर जल्दी असर करता है, लेकिन वो आप वाली बात सही है कि वो डैमेज दिमागी तौर पे फिर वो ज़्यादा ही साइड इफेक्ट होते होंगे ना, ज़्यादा कई सालों से ले रही है तो मेडिसिन वो लेना नहीं चाहती, स्टॉप कर देती है।
I mean, that's something very good. It's very honorable that she does not want to take the medications. Okay, but the problem is that if that's the case, then she and her family has to look into what the cause of the problem is. What is the cause? So I mean, vitamin D, yeah, check the vitamin D level, and if it's low, start taking the supplement. Also, look at the diet, like we talked about already. Exercise is very important. Sleep is very important, but you have to look into the situation. You know, usually when a child is suffering depression symptoms, the problem's in the family. You have to look at the parents. I'll talk about this inshallah on Friday. I'll talk a little about this, but I'll tell you just a summary. Usually, when a problem is in a child, if a problem is in a child in the house, a psychiatric problem, schizophrenia, depression, whatever it is, and the mother is very worried and she doesn't know what to do, it's usually because someone else in the family is not doing their part, is what happens. So, in other words, you have to look at the whole family, and there's usually one person in the family causing the disease, and the other person is trying to cure the disease. I'm not accusing anyone, I'm not making any diagnosis, I'm not saying that you're not a good mother or not a good parent. I'm just saying you have to look in the house and seeing what's happened. Children are our responsibility. When the children is sick, it's not the child's fault, it's our fault as parents. We have to look at the children until they become of age, inshallah. But I think, if you look at the vitamin D level, you look at the diet, for example, and I think that will help, inshallah. And maybe attend the talk on Friday. On Friday, inshallah, we'll touch on these things as well.
Okay, Jazakumullah khair. Shall we take next call? जी चलते हैं नेक्स्ट कॉल की तरफ। अस्सलाम वालेकुम।
वालेकुम अस्सलाम व रहमतुल्लाह।
जी
first of all, I'd like to say, mashallah, the doctor has really delivered his opening beautifully. MashaAllah, I learned a lot from it. It was so in-depth. SubhanAllah, I don't have words to thank him. And may Allah bless him and give him barakah in his knowledge to expand more. It really has surprised me because I don't hear on any channel or anywhere that knowledge given out. And it's thank you to IQRA as well for bringing Dr. Tanvir and explaining to us the good and the bad of our lifestyles. I just wanted the doctor to touch on the thyroid. If you had thyroid and how can you get off the medication?
Right, okay, thank you.
Yes, that's, well, thank you for your kind words. I don't know how to thank you back for saying those nice words to me. Allah yarda alayk, Allah yutika al-afiyah, inshallah. May Allah give you well-being and you and your family for your whole life, inshallah, and in the akhirah. But when it comes to thyroid, yes, I didn't touch on that. That is correct. The thyroid gland, yeah, it's responsible for secreting a hormone, and that hormone is converted in different parts of the body. And that hormone it's kind of like I don't know how you say it, it's like the fuel for the race car. In other words, that hormone spreads across the entire body, affects the brain, the liver, the pancreas, the digestion, you name it. And there is a very prevalent condition called hypothyroidism, which means hypothyroidism means, as you know, and for the sake of the other viewers, that it means you're not secreting enough thyroid. That can be a problem in the pituitary gland, or it could be, usually it's a problem in the thyroid gland itself. And so the replacement is something called Synthroid, which is, it's a synthetic thyroid hormone we usually take. And based on this, we check a level in our blood and make sure the level is between two numbers, and then we continue that, usually lifelong. But yeah, if you want to come off thyroid medication, that would be a great thing. It all depends what the cause is. The thyroid gland is very susceptible to autoimmune attack. Okay, I don't know why that is, but it's known that those who have hypothyroidism usually have other problems, like other inflammatory or autoimmune problems, like hypothyroidism. They have multiple sclerosis, myasthenia gravis, for example, and then even some more nebulous conditions like fibromyalgia, chronic pain syndromes, migraine headaches. They all kind of come together in a lump. So this whole hypothyroidism being a disease, I believe it's part of something greater, and it's usually autoimmune. So I would look into autoimmune diseases and how to cure autoimmune disease, and that's a great challenge. I'm going to go off on a tangent here, I believe. This is my personal opinion. I believe autoimmune diseases are diseases of paranoia. In other words, your immune system is paranoid against your own body, so you're attacking your own body. And that happens in people who are anxious, fearful, who overthink things. In fact, I've noticed one thing, and that folks who have hypothyroidism and usually have anxiety as well, and I noticed that they have wrinkles in their forehead. Okay, there's wrinkles in their forehead. I'll see going up. You know, when we get old, we have wrinkles, but these are different. That comes from this constant alertness, a hyper alertness like this. They're always worried about things, and it could be the people around them. It could be that the people around them are just very high-strung, high-maintenance people, and so it makes you naturally very high-strung yourself and worried. But it's usually folks who are thinking the same things, recurrent thoughts over and over again. And a nice little solution is if when a thought comes to you and you keep thinking it over, and I'm not making conclusions about you, and I'm not judging you, so don't mind me saying this. I mean this as a generality. It's very healthy. When a thought comes to mind and you start focusing on it, and then it comes again a few minutes later, you keep focusing on it, what you do is the first time, let it come. The second time, just understand that thought is not coming from you. I don't want to get into this now, but it's the thought is coming from somewhere else. And what you do is let that thought be. In other words, imagine a child inside of you is talking, and let that child just keep talking. So you know what, go ahead, you talk, have your conversation somewhere else. As if two children are arguing in front of you and you're just sick of them, you say, go somewhere else and have your argument. Say that to yourself. Have yourself say, okay, I already discussed this 5 minutes ago. I already discussed this yesterday in my head. I don't need to think about this anymore. Move on. And so go have your conversation somewhere else. And you'll be amazed that the anxiety and paranoia type feelings, they start going away. And when that happens, autoimmune diseases start to calm down as well, I believe. I've tried this on several patients, and it's interesting that the life does become calmer. Do the diseases go away? It's very individualized. I don't want to get into that data now, but the point is that that's one thing you can do. And the second thing you can do is something physical. And what that is there's a book, I'm trying to remember the name of the author, I believe it's Chang. It's how to, I'm forgetting the name now, Allahumma salli ala Muhammad. It's a book on natural healing, and what he says is you take your 3 fingers and you go to your thyroid gland, which is by the trachea, and you massage them. You do this 3-4 times a day you can massage. It's actually a very healthy way to stimulate the thyroid gland. You know, they say an ounce of prevention is a pound of cure. And so this is something you could do on a daily basis, just massage, learn to massage the glands. Another thing you could do is Kundalini yoga. You know, you don't have to do the chants and Om and all that stuff. You don't have to do, of course. But I'm saying is the point is you can do just basic yoga, certain stretches. They relieve the lymph flow in the body. A lot of the lymph, when it's stagnant, can cause problems in the thyroid as well. So there's a lot of things you can do, but I think these are some of the basic ways. And yes, you can come off the thyroid. Exercise is very important as well. If you do have hypothyroidism, depression is going to come naturally because your body can't move, you can't flow. So that is unfortunately a problem that's, you know, it sounds like it's a disease, hypothyroidism, but I do believe there is some cure. And alhamdulillah, you're thinking about it and you're saying that, yeah, I want to get off these medications. So I think some of these things will help, inshallah.
MashaAllah, Jazakumullah khair. We have only 6 minutes because we need to go towards Adhan and we have 2 calls. Let's take one call very quickly. Assalamu alaikum. Hello, assalamu alaikum.
Wa alaikum assalam.
Yes, brother, your question, please.
मैं नूरुल्लाह एडमरा से बोलता हूँ
जी फरमाइए।
तो मेरे जो नी है ना वो एक नी में थोड़ी तकलीफ दर्द होता है और दूसरा दोनों पर सोज रहता है और 6 महीना हो गया अभी तक कोई सोज जा नहीं रहा है टांगों पर भी सोज है पाँव पर भी सोज है।
ठीक है, ओके, शुक्रिया बहुत। इंशाल्लाह अभी आते हैं हम उसकी तरफ। एक और कॉल ले लेते हैं। अस्सलाम वालेकुम।
वालेकुम अस्सलाम व रहमतुल्लाहि व बरकातहू।
Yes, brother.
I've been suffering from last 25 years.
25 years.
Yeah, 25 years from depression.
Mm-hmm.
And the problem only stays in the morning. I could not go to sleep early. I go to bed about 1 o'clock, 2 o'clock in the morning. Wake up about 9 o'clock. Then, after taking insulin and all the medications, I have to go back to sort of sleep for another hour or half an hour. And by 4 o'clock, I am perfect. I'm a person. I'm thinking like a noble. But in the morning, it's like a different world. I am surrounded by anxiety. And that's been like that for over 25 years.
Right.
And at the moment, I am on duloxetine.
Mm-hmm. Okay, thank you very much for your call. Inshallah, we'll come to your question also. And let me take one very final call of today's program. Assalamu alaikum. Hello.
Hello, assalamu alaikum.
Wa alaikum assalam. Ji.
I just want to find out, basically I suffer from fibromyalgia and I've suffered a heart attack as well. I do suffer from depression and stress, but I've refused to take any medication for the depression. Is there anything else that I can do with regard to the stress and the depression? If you can give me some advice, please. Thank you.
Okay, thank you very much. Thank you. जो सबसे पहले कॉल आई थी about knee problems. I think, look, today's topic is depression and I think knee problem is something else. So we'll focus on last 2 calls at the moment because we have only 2 minutes to go for Maghrib break.
Gotcha. You just remind me the second question, what it was?
You are the doctor, so.
I'm sorry. I was focusing on the last question on fibromyalgia and. I remember. Yes,
the second question was 25 years.
I got you. 25 years. Okay. Yeah.
25
yeah.
Years.
Sorry about that. Yeah. So it's been a long day. I apologize. But the second question, yeah, the gentleman who feels okay at certain times of the day, doesn't feel okay at other times of the day, that is diet. That your depression is related to your diet, and the problem here is your insulin. It's related to your insulin. Your insulin flow is unpredictable. That's the problem. Now, the way you get rid of insulin is very simple. If you eat a food, okay, eat any kind of food, especially with sugar in it or carbohydrates in it or starches in it, like bread, potatoes, it's sugar, candy, mithai, whatever, that shoots your insulin up for about 4 hours, and then your insulin comes down. If you don't eat anything for 4 hours, the insulin comes down to 0. And then 8 other hormones kick in. And these 8 other hormones are going to fix all the damage done by insulin. The problem in our culture, and what I mean the world's international, the culture, especially the West, is we're swimming in insulin. We're always eating. In fact, if you go 6 hours without eating, it fixes the damage done by insulin. If you go 12 hours without eating, it fixes the damage done 2-3 days back. In fact, it's very interesting. I think it was Sahal bin Tustari, radiallahu ta'ala anhu. He was one of the, they say one of the awliya, one of the very spiritually guided people, men of our time, rijal of our time. He said, he was asked one time, he said, what do you say about people who eat once a day, one meal a day? Okay, meaning if you eat once a day, you go 24 hours without any food, your insulin is washed out. You heal your body for the past week. If you go once a day, you eat, every day you're healing, right? So when you do that, it's very, very healthy. So he was asked, what do you say about someone who eats once a day? And Sahal bin Tustar, he responded, Aklul Anbiya. He said, this is the food of the Anbiya, of the prophets. He said, what about people who eat twice a day? So if you eat twice a day, then you have a 12-hour fast on average, which is very, very healthy to do, extremely, extremely healthy. He said, Aklul Salihin. This is the food of the Salihin. And then he said, what about people who eat 3 times a day, which is all of us? He said, dig them a trough. You're going to bury them soon. They're going to die. Meaning, and this is how we eat, this is the problem. Now the problem with your problem in your situation, 25 years, if you're taking insulin, I don't know what you're able to do. If you can get down to eating 2 times a day only, I think it'll help you tremendously. I think the problem is your insulin is too high and you're taking insulin on top of that. But if you stop the insulin, then your blood sugar is going to go too high. If you take too much insulin, it goes too low. So you have a chronic disease, so it's very difficult to answer. But you need to talk to someone who specializes in insulin and say, how do I get my insulin down naturally? And unfortunately, if you go to an endocrinologist, the endocrinologist is going to tell you to keep taking the insulin. You have to find a natural healer who can take your insulin down. But the goal is get your meals down to 2 meals a day or 1 meal a day. You can do water all you want. You can do salad without any calories. You can do that. You can do tea without any sugar or cream. That's fine. But you have to get your meals down to 1 or 2 a day. And I bet your problems will all go away, inshallah. The last problem on fibromyalgia and stress, that's a loaded question. There's a lot to talk about. What you have is, I don't believe you have fibromyalgia. I don't believe you have stress. I don't believe these things. I mean this in a very good way. I think you're a normal human being, but what you have is something called psychosomatic illness. In psychosomatic illness, it means that memories of your past, whatever you've gone through in life, you've gone through some major traumatic memories. And it's started probably in childhood. Again, I'm just guessing. It must have started in childhood. These memories have stayed in your body. And when they stay in the body, they come out from the body, and they come out as pain and so forth. It usually happens when you grow up with someone you trust who you grew up with violated that trust and hurt you. Now, I am not trying to cause paranoia. I'm not saying to go find this person who did it and then go do zulm on them. I don't mean that. It has no benefit whatsoever. Whoever did whatever they did, Allah knows. Allah knows the truth. The solution relies in you. And the more you go back in your past and try to figure out who did what, you're going to make the problem worse. But this is something called psychosomatic illness. I'll talk about this. I'm going to touch on this, inshallah, on Friday, in the Friday evening talk. But I believe that the solution lies in you itself. It's not easy to come out of psychosomatic illness, but you have to get the memories out of your body and into the mind. Again, I apologize. I can't give you more detail on that right now, but this is a whole field. This is actually my subspecialty in my field. I've been treating, for 11 years, I've been treating patients using natural means, treating with psychosomatic illness. But inshallah, may Allah give you tawfiq, inshallah, to find the cure to this, inshallah.
MashaAllah. Jazakumullah khair. May Allah subhanahu wa ta'ala reward and bless everyone who have participated in today's program, this evening's show, by calling in this program or by even watching this program, mashallah. And I hope it's been great benefit, inshallah. We will have another session, inshallah, on Friday at 7 p.m. 7 p.m. till 9:15, 9:20 p.m. inshallah. That will be live from Bradford studio. We will be in Bradford studio from 6:30 p.m. So if anyone would like to meet us in person, you can meet us there at 6:30 inshallah, or after Maghrib we can have a discussion. We can have live audience also in Bradford studio, so you are most welcome to join us in live discussion over there, inshallah. Tanvir Syed is my brother-in-law from America, mashallah, who is visiting UK only for 2 days, unfortunately. Saturday he is flying back. So all the best to everyone. Thank you very much for taking time out. And I know this is your favorite topic, favorite lecture. So one tick in your to-do list is done, mashallah. and I'm sure that everyone will benefit from this. We will certainly play a repeat of this program, and everyone will know very soon, inshallah, the timings of it. Jazakumullah khair. We have to go towards adhan. Assalamu alaikum wa rahmatullahi wa barakatuh.